Okay. Good morning again. My name is Eyal. I'm from the Environmental Economics and Management Department, and Aron asked me to step up for him, just keeping the order here. So I hope you all keep in order. He couldn't be here because of an emergency situation in the family, but he will be online as much as he can, and maybe even join us later in the day. So I'd like to begin by inviting the Vice Dean for Research, Hayuka, please.
Okay, it's my great pleasure to honor you and to welcome you today for this important meeting. And of course, I would like to give a special thanks to Professor Aron Troen, who made this day happen. And unfortunately, from personal reason, who could not join us today. But thank you, Aron, for taking all the efforts and the time and put all of this, all of us together today. So thank you, Aron. Also, I would like to thank Professor Roni, the head of the National Nutritional Security Council, to Professor Amy Yaroch, the director of the Grange Swenson Center of Nutrition from USA. I'd like to welcome Roni from the BARD, the National Agriculture Director, and of course to Bituach Leumi and Eshel Yerushalaim, Pitchon, Latet, Leket Israel, who devoting their time and efforts to overcome and to deal with the food security topics, crises, and ways to deal with in the recent years. So the food security is a major concern all over the world, and of course it's a global concern, but each country needs to deal with it differently and uniquely, depends on the region, depends on the sources and geographic and many other aspects, but I think it's very important to deal with it also globally and nationally. So this is very important. And of course, I think today, after the corona, that we had a lot of tough days in the corona crisis, and now the Ukraine war, and many other crises all over the world, that makes the topic of food security very relevant to these days, even though it seems to be very ancient and like it's not going to happen for development countries, Israel or USA or other countries. But I think this crisis really demonstrate all of us that we are very small at the end, and there are huge crises that along the way that we need to deal with them together, but and to be prepared. This is the most important part. So I think the food security is very important. And I would like to introduce you our faculty and the vision of the faculty that is very relevant to the food security topic. So the Hebrew University has several campuses. 3 of them, the main campuses, are located in Jerusalem. And we, as the Faculty of Agriculture, Food and Environment, needed a flat area to have some fields and to grow some produce. So we established the Faculty of Agriculture in the central of Israel, in Rehovot, close to Tel Aviv, as we are today. So this is an overall. We have also very interesting research center in Eilat, but this is another topic. So the Faculty of Agriculture was established in 1942. We had 21 students. This building is the same as was in the beginning. At the beginning, it was independent faculty, and in 1952, it was affiliated to the Hebrew University. So we started from 21 students, and today, this is the faculty today. You can see, but it's my daughter here having fun near the pool here. We have 2,400 students here. We have 500 annual courses, We have 15 study program, also for bachelor degree and also a master degree that is given in English in order to have more and more international students. We have 1,500 undergraduate students. We have almost 400 master students, almost 300 PhD students, and we have 240 vet school, the only vet school in Israel, who right in that building in behind. So the faculty really grows, and we are keeping growing and updating. And I think this is a very important slide because it's also very relevant for today's meeting, is the vision of our faculty that is established like at least 25 years ago. And the vision is to supply sufficient, high quality and healthy food to the world's expanding population. This is the main goal of the faculty, of course, without causing any damage to the environment, and of course, to be sustainable and bio-based economy. And I think this is the main topics that we are studying here in the faculty: agriculture, food, and environment, and the notion of One Health also might present the vision of our faculty. We are dealing also with human health, environment, and animal health, and the food security is right here, but I think it's much more important than the size of this point. And we in the faculty are working all the aspects, and of course also on the others that could not make it here, but the vision is very clear, and we have several institutes in the faculty. We have the Institute of Biochemistry, Food Science and Nutrition, where is Aron and myself from the institute. We have also the Plant Science Institute. We have the Animal Science and the Vet School. And we established recently a new institute of environmental science that included the soil and water, which is very important, plant and pathology, entomology, and environmental economics. Eyal Kimchi is from that department. So we all work here on several aspects on this direction under several institutes, but the main goal is to serve and to provide a food security networks along the food chains from the farm to the consumers. So without any more details, I will let the day to start, and I would like to thank you for coming, and I wish you a great and inspiring day. Thank you.
Okay, thank you, Zika. I would like to share with you Aron's recorded opening statement, which he sent to me about 3 a.m. today, local time.
Dear colleagues and friends, I regret that I cannot be with you this morning to welcome you in person to the Hebrew Robert H. Smith Faculty of Agriculture, Food and Environment, where our mission is no less than the grand challenge of feeding the world now and tomorrow, and to end hunger by helping to build a resilient, sustainable, nourishing, and fair food system from farm to fork through research, teaching, and public service. The global challenge of feeding the world's hungry population despite an ample food supply has been driven home in the past few years by the convergent crises of COVID, conflict, and climate change. We are rightly proud of our groundbreaking and transformative research on ways to improve agriculture and food production. But if the saying that the poor of one's own city comes first, then it is also our obligation to bring our science to bear and examine why so many in our midst are food insecure, go hungry here in Israel, and to evaluate existing responses by government and private actors, and to offer new, better solutions to the present ones that clearly fall short. So it is a pleasure and privilege to host members of the National Nutritional Security Council, headed by Professor Roni Strier, as well as by members of the newly established Scientific Advisory Committee, who will meet here in person for the first time today. For the Council to succeed in its statutory role of advising the government in the early food security policy, it is vital that it has access to independent, transparent, and comprehensive, cutting-edge scientific input so that it may develop, execute, and evaluate food security policy in Israel, and to integrate that policy across governmental and non-governmental agencies. I therefore applaud Roni's decision to establish the committee, and we look forward to working together to help ensure that no child or person in Israel goes hungry. The scientific can only do its job if it has a clear and comprehensive view and free access to all of the existing data on food insecurity in Israel. However, rigorous peer-reviewed academic research on this topic in Israel is limited, and raw data from government and NGOs alike are often partial or late, not freely available to researchers, and only indirectly linked to policy interventions. Lack of research impoverishes public discourse, impedes the diffusion of new ways of understanding food insecurity, and blocks advances in mitigating it that otherwise might be introduced into our policy process. To begin to remedy this, we have today convened key experts from government and NGOs to map out not only what is known about food insecurity and hunger in Israel, but how we know it, what raw data they collect, what measures to be, and how are they validated, what type of data is missing, and what are the barriers to collecting it. Given the scope of the need, where an estimated 1 in 6 Israelis is food insecure, we need to understand the effectiveness, efficiency, and equity of the solutions on offer today, and consider the most effective ways to drastically reduce poverty and hunger in it. In our first session today, we are fortunate to have Drs. Amy Yaroch and Aron Calloway from the Gretchen Swanson Center for Nutrition, USA. Amy directs the center and is responsible for evaluating innovative programs across the United States designed to incentivize nutritional improvement among food aid recipients. To give you an idea of the scope of the program, her federally funded research budget alone is larger than the entire budget of the Israeli Ministry of Welfare's food aid initiative. And as you will hear, the data show improving the nutrition of food aid recipients yields a tremendous return on the investment in terms of equity, health, and money. Dr. Calloway will describe new measures that expand our understanding of food insecurity beyond economic access to include resilience, nutrition, and well-being of the aid recipients. Interestingly, the development of these new measures was funded by Walmart, which pays many of their own workers minimum wage, thus putting them at risk of food insecurity. This brings to light the question of the appropriate connection between the private and the public sectors in dealing with these issues. We will then shift to focus on information available for Israel. First, Dr. Miri from Leumi and Yafit Alfandari from the Central Bureau of Statistics will describe some of the official data that are routinely or occasionally collected relating to food insecurity in Israel. Next, we will hear what data are available for the two competing policy responses to food insecurity in Israel. Mendi and Eshel Yerushalaim will describe the Ministry of Welfare's National Nutritional Food Security Initiative, which feeds today 26,000 of the roughly 150,000 eligible severely food insecure households on a budget of around 105 million shekel from the state budget and partial matching by philanthropy. They provide a monthly cash card and 20 kilograms of fruit per household, irrespective of the household size or needs. In other words, giving away commodities. Cohen of Pitchon will describe what he can of the data collected and lessons learned from the distribution of 700 million shekels worth of emergency food vouchers by the Ministry of Interior, otherwise known as dairy vouchers, during COVID. In both cases, the effectiveness and efficiency of these competing approaches to food insecurity, cash or commodities, and their details have yet to be rigorously and independently studied. Yet the terms of these contract operators stipulate that the data collected are confidential and not to be made public. Finally, Gilles, Darmon, and Gidi from Latet and Leket, respectively, Israel's two leading food banks, will describe the research that they conduct independently in the interest of their operation and advocacy. And Samah Elkhatib Ayoub from Sikkui will make a compelling case for the need for inclusive research that addresses the needs of marginalized groups in Israel. After these sessions, speakers and council members will retreat to a closed working meeting to begin to identify opportunities for sharing data and making it accessible to the Israeli and international research community. and to outline the necessary formative and evaluative research to advance solutions in Israel. I hope today will mark an important step forward in enhancing collaboration between government, civil society, and academia, so that we may enhance our capacity to improve Israeli food security. And if we succeed in that vital endeavor, the lessons we learn may be shared with the world. Thank you, and good luck in your discussions and deliberations.
Okay, so I'd like to invite Roni Strier from the National Nutritional Security Council. Please.
Well, good morning, and thank you for inviting me to be part of this meeting, and more than that, for promoting a very committed agenda to push the issue of social security, of food security at the top of the agenda of the scientific sector of Israel. It was last week in one day with you, tomorrow at TAO conference on health inequalities, and I think in the last year I was in several meetings where the things of issues of food security were discussed openly, and I think that it's a very important contribution of the academy and the scholar etc. of Israel to promote more comprehensive and more informed policies in food security. I myself, I just new in the area of food security. I'm studying the issue of poverty and social exclusion for 40 years, but I was surprised by the incredible scope of the issue of food security. I thought that poverty is the most discursive topic in social sciences, but being just a few months learning about food security, I found just more than 200 definitions of food security, like 10 different discourses of food security, clashing, complementary aspects of food security, etc. I'm visiting several organizations in Israel that are doing incredible work in the field. I met different official organisms like ministries with no connection between them, data missing, etc. In one word, is a mess, and I'm trying to put together myself with my limited cognitive skills at my age. I think that Aron is at 3 a.m. in the morning is better shape that I'm doing to put together all this stuff together and promoting a policy that put together all these things. So I see myself as the head of the national food security. Again, this is discourse. In English is nutritional health, nutritional security. In Hebrew is food security. Look at how this course is so important here. And I think that my job with the council, eventually we will have a new government that will be ready to be informed by issues of social food policy in the next weeks, is to put together a plan, a national plan that incorporates all these different aspects of food security, including issues of climate, food safety, sustainability, etc. So thank you for keeping this top issue, a hot issue, an important issue at the forum that we have again and again. And thank you for the scientific committee to promote more and more research that inform policies in Israel. Thank you very much.
Thank you, Roni. And so I think really perhaps the first task of the council would be to make us a good definition of what the difference is between food security and nutritional security. I think it's important for defining the problem. So we move to the first session of today. So I'd like to invite Amy Yaroch from Gretchen Swenson Center for Nutrition to talk about what data is available in the US and how it is handled, et cetera, et cetera.
Dr. Tove, I said that right? Good morning. All right, I'm getting closer. So actually, it's really an honor for me to be here. Me and Erica, we really appreciate the invitation. I am actually, this is my second visit to Israel. My first visit was when I was 3 years old and my parents moved to New York City to Israel for 9 months. So I don't remember it, but I'm very excited to be back. So I'm Amy Yaroch. I'm Executive Director of the Gretchen Swanson Center for Nutrition, and I'm also a grant writer, researcher, and I've been at the center for 13 years and we work across different areas, which I'll talk about. But before that, I was actually at the National Institutes of Health. So it's at the NIH, the National Cancer Institute, for 6.5 years. So I have experience both being in the government and at a nonprofit. So again, the Gretchen Swanson Center for Nutrition. So we are a nonprofit nutrition research center. It's interesting to describe it to folks because we're like academia, but not academia. So I have an appointment at the university to be on doctoral committees, master's committees, but the center is a separate 501c3. So we're a separate nonprofit. We're governed by a board of directors, and we're headquartered in Omaha, Nebraska. Does anyone know where Omaha, Nebraska is, like in the US?
In the middle.
Yeah, so if you take I always say if you take a map and you fold it in half, you open up in the crease, there is Nebraska. It's right in the center of the country. So we conduct a lot of measurement and evaluation and our own independent research across a variety of topic areas. So food insecurity being first and foremost, but we also do local food systems, childhood obesity prevention, which now we're calling healthy eating, active living, and social determinants of health. So today I'm just going to cover a few things. I'm going to give a definition and importance of financial incentives. I'm going to talk about the Gus Schumacher Nutrition Incentive Program, which is a program in the United States that is directed towards improving nutrition security. I'm going to give an overview of our year 2 impact findings. We actually have our year 3 in the works. And then I'm going to give a context in the US as well as terminology around food as medicine. In talking with Roni Strier, we talked about the fact that food as medicine is not necessarily like a term that resonates with people. Same with produce prescription. It has a very clinical context, but the idea is that it's putting healthy food to people who are food insecure so that they could achieve nutrition security. And then could financial incentives be a path forward here? So what are financial incentives? So financial incentives for consumers include vouchers, tokens, or some other type of redemption for low cost or free healthy food. In many cases, this is fruits and vegetables. For the GusNIP project in the United States, there are 2 main types. So there's nutrition incentive and produce prescription. And I feel like I was at a meeting the other day and I went through it, I think, a little too quickly. So stop me if you don't understand any of this because it is kind of a little bit complicated because they're different. So nutrition incentives are specifically for people who are participating in the Supplemental Nutrition Assistance Program, otherwise known as SNAP or food stamps in the United States. It's the largest federal food assistance program in the US. And the way that it works is that participants get a certain amount of money, usually this is per week or per month, where they could use vouchers, and they could do this at grocery stores, farmers markets, mobile markets, and other food retailers. And in this case, they get typically double the amount of fruits and vegetables. So if I'm on SNAP, I could go to a farmer's market, a grocery store, and if I have a $10 voucher, I'll get $20 worth of fruits and vegetables. And a lot of times this will be weekly, sometimes there'll be a larger amount. So it's really pretty incredible. Produce prescriptions work a little bit differently. So in this case, people do not need to be on SNAP, so they don't have to be SNAP participants. In this case, they can visit a doctor or a clinic, and if they screen positive for food insecurity and they have some kind of diet-related chronic disease, usually like type 2 diabetes, then they get a voucher in this case to get free, usually free or reduced cost fruit and vegetables. And so this again could be weekly or monthly. I visited a program recently in San Diego, California, and it was pretty amazing because they have a food hub where it's a collective of farmers that are doing organic fruits and vegetables, like really, really high quality. And in this case, the they're dropped off at people's houses. So people don't even have to like go and get the fruits and vegetables. So they enroll in the program, and lo and behold, they get $50 worth of fruits and vegetables delivered weekly to their houses. You had a question?
What do you mean by screen positive for food security?
Very good question. So there are a couple of ways to screen positive in the United States. A lot of times the 2-item vital hunger signs is used to screen positive. Sometimes it's the USDA food security module, which is a 6-item, a 10-item, an 18-item. But a lot of times, at least in the clinical settings, they use the 2-item because it's very brief and it can be done by a doctor or practitioner. And so they screen positive, and then a flag will come up to then say, then they're also have diabetes. And then they say, oh, we want to tell you about this program. It's free of cost to you and you can enroll in it, and then they get started. So it's pretty cool. So, you may say, why incentive programs? So both these types of programs weren't merit as a strategy to increase fruit and vegetable purchasing and then ultimately intake. So we call this in the US a carrot approach. So carrot versus stick. Do you guys use that kind of term here?
Yeah.
Like waving a carrot. So a carrot approach meaning that the consumer choice is enhanced through basically incentivizing fruits and vegetables, whereas disincentives are also a good type of program. And you have here, I think, sugar sweetened beverage tax. So that's a disincentive, but that's considered a stick approach, which basically restricts consumer choice. So although they're both viable in the United States, incentives have a lot of backing. They have a lot of bipartisan support. So both Democrats and Republicans like them. So financial incentives really play, this is a big figure, but just to say that they're really important in addressing health disparities by, again, supporting the purchase of fruits and vegetables among low-income groups that experience food insecurity, social determinants of health, and then they promote this healthier food consumption, and ultimately we hope lower the risk for diet-related conditions. So I always talk about the fact that we're moving more towards prevention versus treatment. So for all the years that I've been working on fruit and vegetable, increasing fruit and vegetable consumption for the last 25 years, and different approaches to do that, including the 5-a-day program in the US that I worked on at one point. And I just think there's been so many different ways that we're going about it. And to me, this feels the most tangible, like that I'm able to really be as close to the people and seeing how it all works. So I've been really excited by these financial incentives. So then about the GusNIP program. So this will give a little context, I hope. So this started out years ago. And what I like to say on this slide is you see the different administrations, whether or not you like any of them. I like one of them, not the other two, but won't get political. Using funding from Congress in the 2008 our Farm Bill for a healthy incentives pilot, the United States Department of Agriculture was working with the state of Massachusetts to conduct a randomized control trial on the impact of financially incentivizing 7,500 SNAP households. So this was the first really strong study of its type to purchase produce for 1 year as compared to SNAP households in the same county that didn't get any incentives. And in this case, they did show an increase in fruit and vegetable consumption. So that was really exciting. So that really paved the way for the next iteration, which was FINI, which is the Food Insecurity Nutrition Incentive Program. And in this case, Congress funded nutrition incentive and then for $100 million over 5 years. And over its 4 years, FINI funded 114 projects in 47 states, so almost all the states in DC. So then that brings us to 2018, where Congress funded the next iteration of FINI, calling it GusNIP. So after Gus Schumacher, who was a former USDA undersecretary and a nutrition incentive champion. I know people know him and said he was like the nicest guy. So this time the appropriations were $250 million over 5 years. And in this case, before produce prescription wasn't really a part of it, like some did a variation of it, but it was formally introduced in as a pilot program. I just wanted to show you, this just shows the sheer magnitude of money in the United States that goes into SNAP and nutrition. So you could see $65 billion per year. So you can see it in comparison to everything else. And I mentioned SNAP being the largest of the federal food assistance programs. We also have WIC for SNAP is the Supplemental Nutrition Assistance Program, and it's what was known as food stamps. Oh, we have WIC and we have school lunch and we have other programs as well. All right, I'm going to go a little bit more into how these programs work. So I told you a little bit about it. Now I'm going to dive in. So nutrition incentive projects are typically larger in the grant amount. So some of these go up to like $13 million, but they require match funding. So like the state of California is an interesting example because they got, in their last iteration, they put in $13 million of their own money. They had to get it competitively reviewed. They got accepted, God bless you. And then they had basically the state of California didn't put in another 13 million. The state of California put in 17 million. So they even did the match and then some. So these are really designed to be higher reach. So they go out to a large number of participants. And they a lot of, just at farmers markets, grocery stores, all over the place, whereas, like clinics are less so. So they tend to be lower in amount. So like I was saying, a lot of times it's like $10 to get $20. And they have a repeated cross-sectional design. Yes.
Can you tell us about how much it is per family? Talk about these big numbers. But in California, if it's $30 million, how many a family would get in aid? More or less, no.
So that's a great question. And I could answer that because I was just in California. So, and that program is it's fascinating because that one has a stipulation because of the state that they have to be California grown fruits and vegetables for that particular one. So it doesn't operate in grocery stores, like maybe a few, but it's mainly in farmers markets. So I had an opportunity to go visit a very diverse farmers market. It was diverse as far as the vendors and the people who were going there. And what was explained to me is that the way that because of the pandemic, EBT, all this other extra money that came into the system, that if someone wanted to, they couldn't do this at the same farmers market, but they could go to 9 farmers markets throughout Sacramento in this case in 1 week, and they could get $90 worth of produce for their family. And that's, each of the programs set the amount of time, maybe it's a year, what have you, that people could be in the program because they want to make sure they have enough money for other people. So it's for a participant, but the idea is to feed the household. And they really vary. So I couldn't even tell you, like some will be, $50 a week. Some will be only, $10 or $20 a week. It depends if it's a smaller region. A lot of times it's not, like a rural region that maybe it's not as expensive, then it'll be a lower amount.
So, but how much is the SNAP, for example?
Oh my gosh.
125.
Sorry.
It varies by household size, but the average is 125 per family per month. Yeah.
I'm sorry, I didn't understand it, but
125 per person. So it varies a lot by household size, but on average, I believe it's 125 per month per household. Per household.
yes.
Just to understand, the initiative, the initial, the payment for the family is 500 shekel. The family is, here.
But the price of
Regardless,
fruits and vegetables are very, very high.
Regardless the size of the family.
So the idea here is that it's doubling the amount of their regular SNAP incentive. So if they have $10 and they get $20, if the program does $20, then they get $40. So
One thing just to clarify, so this is an add-on to SNAP.
oh yeah, this is separate from SNAP.
Yeah.
This is the Gus Schumacher Nutrition Incentive Program. So this is not SNAP, meaning it involves SNAP participants, but it is a totally separate program. And I'll talk more about the program. Thanks.
The $125, it's the ad, just the addition to the SNAP, or including the SNAP?
No, that's the amount of SNAP per household. Does that make sense? Okay. So, okay, produce prescription, again, this is different. It's a lower volume of participants because it's a healthcare setting and they focus on really addressing chronic disease. So they're more intensive as far as the nutrition education goes and the consultations, clinic consultations. And again, these are considered pilot projects. So the other ones that are in the millions of dollars for someone who's a grantee and NGO that applies, these are capped at $500,000 US dollars, and they're for 2 to 3 years. The thing is that they're higher dose. So what that means is that they generally receive a greater amount of incentives and so higher dollar values. And so that and then also this more intensive nutrition education. So and then I didn't even say, but going back to nutrition incentive, the first one, really what they say is that there's a trifecta of benefits. So increased purchase and consumption of fruits and vegetables among low-income SNAP consumers, increased produce sales and expansion of consumer base at retailers. And then the third is increased economic impact to communities, because there's all these dollars being spent within the community that then are kept within the community. And then with produce prescription, on the other hand, these are, because they're more intensive and they also have a pre-post test. The idea is to have patient health improvements and chronic disease reduction. So in some of these, we are going to have electronic health record data starting next year. So we will be able to see like hemoglobin A1C, BMI, blood pressure, in an aggregate level across different grantees to see, are these programs actually improving health outcomes in healthcare, utilization, and all those other really important things. So I'm just going to run through this pretty quickly. So this is like, it takes a village. So the Gretchen Swanson Center for Nutrition, this again came about as a result of the 2018 Farm Bill. We actually applied for a grant from the U.S. Department of Agriculture, and we received a 4-year cooperative agreement for $31 million. And that was for all of our partners for reporting and evaluation and technical assistance and innovation. Essentially, we're the coordinating center. So, but my group really helps grantees figure out the reporting and evaluation structure. We have set shared measures that they need to use, and so that we'll have consistency across, and that we'll be able to see at the end and even each year any improvements. The other thing to note is that when we went into this last year, the American Rescue Plan Act, that's a special thing that happened through Congress, and then USDA gave us an extra $2 million because just for us, and they gave $40 million to the grantees, just produce prescription, because they wanted more produce prescription grantees since there were less of them in the system. And so the idea was that now there's going to be an extra 61 grantees that they did not anticipate. Otherwise, it was capped at 10 grantees per year. So I'm running out of probably. I need to leave Eric some time. So I'm gonna give you just a little glimpse of our findings, and since I am short on time, I may run through them a little bit quicker. So we're now in year 4, and we have findings from year 3 that are currently being analyzed. Every year we have to produce a report to Congress. That report's going to go in a couple of weeks, and then we will turn around a public-facing report that everyone could see that has all the information. So in year 1, we didn't have any consumer level data because of COVID. And then the second year we did, and we had 30 grantees that contributed to this data set, and about 2,000 sites. So these are retailers, like farm directs, so farmers markets and grocery stores, registered to offer incentives during year 2. And then we had participant level data from about 10,000 people. So this next year, and as we build on, we'll have more and more, data and greater sample size. So I'm going to give you a brief overview of the results. And I will say that in peeking at the data for year 3, everything looks consistent. So everything that we're seeing in year 2, we're also seeing in year 3, and if anything, maybe a little stronger. So this chart shows fruit and vegetable intake among nutrition incentive participants, stratified by the amount of time that participants report having been in the program. The main thing you want to take away from this is that the longer they participate in the program, the higher the fruit and vegetable intake. That's the main thing. And these are really clinically significant numbers, especially this is the light touch, if you remember, this is the light touch intervention. So this slide shows the percentage of nutrition incentive participants reporting food security or food insecurity by, again, retailer site. So brick and mortar, just so you know, means like a grocery store. And farm direct, again, means like farmers markets and other farm venues. So on the right of the screen, you'll see all retail site types, and it shows that 62% of participants reported that they were food insecure when they completed the survey. But we found that a longer participation in nutrition incentives, there was greater food security. So again, this is a really great finding. Now we're moving on to produce prescription, the pilot programs I was telling you about. So these are more intensive. So the mean baseline fruit and vegetable intake increased about a quarter of a cup, which again is really impressive and difficult to do. So we were super excited. And then as far as food insecurity, again, we saw an inverse trend between the four. So the US food security module breaks it up into different levels of food security. You can see on the bottom of your screen. And so we saw an inverse trend between the four security levels from baseline to post, with high food security increasing the most among participants and very low food security decreasing by almost half. This is pretty exciting too, because this is what I was telling you about. This is the economic impact. So this is the retailers in the community and, you know, just what's happening within the community itself. So the economic impact, this is the amount of money that was generated by supporting the program that went back to participants, farmers, grocers, communities. $41 million was the economic impact. That's why Republicans like it. I mean, I'm not trying to be again, but they like it because that it keeps the money within the community. And then what we're seeing actually in my sneak peek at the next year's data is that this number goes up to over 100 million. So pretty remarkable. And if you are interested in this report or our next report, please visit the website, nutritionincentivehub.org, and you could follow us and, you know, any information if you're interested, but you can also contact me. But I have more to say. So I'm going to give you the context in the US right now. On September 28th of this year, the current administration hosted the White House Conference on Hunger, Nutrition, and Health. This was the first conference of its kind since 1969. I was born in 68, so. And I was really honored. I actually got to participate. They had 600 people that were in person and a lot of people that were, Zoom or streaming. So it was really an honor to be there. So the day prior to the White House conference, the Biden-Harris administration released their national strategy on nutrition, hunger, nutrition, and health. And the goal of this national strategy is to end hunger and increase healthy eating and physical activity. But the physical activity is actually not as well outlined as the healthy eating, quite honestly, by 2030, so that fewer Americans experience diet-related diseases and also reduced health disparities. So these are just the 5 pillars that they're focusing on. It really kind of goes across the spectrum as far as improving, food access and affordability, integrating nutrition and health, empowering, consumers to make the healthy choices, supporting physical activity. The last one is the most relevant to us at our center, which is enhancing nutrition and food security research. All right, so I'm going to talk a little bit about food as medicine. I just thought it would be good to bring up in this audience. Again, whether or not you like the term, just kind of focus on the concept of it. And so I thought it'd be useful to share this visual framework. I don't know, have any of you seen this? It's pretty new. It was developed by Daria Mazafarian, who's at Tufts University, and his colleagues, and it really is an evolving framework of programs and interventions in healthcare and population health to integrate food-based nutrition interventions. So you could kind of see, this is what I was saying before, it's trying to flip the paradigm of treatment more to prevention, having more of these broader programs. As you move up to medically tailored meals, that's more precise. So as far as like having this is someone, usually medically tailored meals is someone who has a disease already and is far along and then gets, some meals that are healthier to help combat that. And so we also have in the United States, CMS, which is the U.S. Centers for Medicare and Medicaid Services. And so they're making an investment in food as medicine by piloting Medicaid prescriptions for medically tailored meals. So that's happening in Massachusetts, North Carolina, where I live. So I said that I didn't mention the center went completely remote at the end of last year. So Eric is still in Omaha, and I just moved to Asheville, North Carolina a few months ago. So I'm in a state that's doing a lot in this area. And then also California. And together with these interventions, for housing and other social determinants of health. These investments are just amazing. They're $150 million in Massachusetts, $650 million in North Carolina, and several billion dollars is what they're expecting in California. So these Medicaid demonstration waivers are providing states with an avenue to test new approaches in Medicaid that differ from what was allowed by the federal statute. And so I should back up and say Medicaid is the United States public health insurance program for people with low income. And it covers 1 in 5 Americans. So the Healthy Opportunities Pilot, which is the one in North Carolina, is the first comprehensive program to test and evaluate the impact of providing select evidence-based non-medical interventions related to food. So food is one of their main areas, as well as other areas like housing, transportation, interpersonal safety. And this is for high-need Medicaid enrollees. And the federal government has authorized up to $650 million in this Medicaid funding in North Carolina for these pilots over 5 years. I've had an opportunity to meet some of the folks that are working on this, and they're really like scrambling because they're like, wow, we have all this money. So someone comes in and they screen positive for food insecurity, we could get them into one of these programs. And so this is separate from the GusNIP project. So it's incredible that some of the grantees that are GusNIP grantees are also grantees for some of the money that's going out from the state of North Carolina. So one thing that we're about to launch, and I'm going to say Eric is actually the principal investigator on this one. I'm happy to take a back seat on this project in partnership with Feeding America. So Feeding America is a national CBO in the US with about 300 participating food banks. So they're an umbrella organization for food banks. They're pretty well resourced as compared to, say, food banks or food pantries that are on their own. And the funding is coming from Elevance Health Foundation. So this is like it was Anthem. And so it's a healthcare foundation who is very interested in food as medicine. And they're implementing the 3rd iteration of their food as medicine initiative. So they put out an RFP to food banks, and they were hoping to fund about 30 food banks throughout the country. And they ended up with 27 food banks. So we call it FAM3, and FAM3's overarching goals is that patients with chronic diseases experiencing food insecurity have access to nutritious food that facilitates better health. And so this is a little bit of a different model. So we're using Feeding America's network measurement, evaluation, and learning. They call it a MEL approach to evaluate. And we're doing this very collaboratively with Feeding America, Elevance, and then these grantee dyads. They're going to be organized into groups that we call like pods for learning collaboratives. And we're going to do, this is going to be mixed methods. So we are going to have both quantitative and qualitative to assess any kind of immediate, intermediate, and long-term outcomes. And so we're again, very excited to jump into this project. I don't mind telling you too, just for context, this one is a $2 million project over 3 years. So is there a path forward using financial incentives in Israel? I'm asking you, I'm curious what you think after all this. So from what I understand, the healthcare system in Israel is, I think, less complicated and less restrictive as compared to the healthcare system in the United States with electronic health records. I think you have easier time accessing. You have all these HIPAA regulations. I'm sure you have regulations, but ours are incredibly complicated. And then you have more of a universal healthcare system from what I understand. And so from my point of view, there's really this like nice potential to promote public-private partnerships to enact, say, produce prescription, again, food as medicine, whatever you want to call it, between NGOs, healthcare, government, and anyone else you want to bring in. But it's really, again, more of an empirical question. I'm curious, given what you've heard about financial incentives and their potential to increase fruit and vegetables, decrease chronic diseases, educate consumers, and result in healthcare cost savings and increase healthcare utilization and decrease food insecurity. To me, there's so many benefits. Could they be implemented in Israel? And I am happy to help in whatever way I can, because I think it's so important. It's been an honor for me to be a part of this in the United States, and would love to see any of this translated to any other countries, including Israel, as I told you, where I lived a long time ago. And so with that, I would like to acknowledge other folks who helped me on this presentation and any of their contributions there, as well as this is my information. If you can feel free. I have some business cards and otherwise, but here's my email address. I welcome any questions you may have, as well as any contact in the future. And I just appreciate your time. Thank you.
Thank you. No, we'll do questions at the end of the session because Eric's presentation is really a natural continuation of this. I just want to tell Roni that please add to your to-do list nutritional insecurity, food insecurity, and hunger. That's important. So Eric, please.
Thank you. All right. Well, thank you guys for having us. We really appreciate it. I'm going to kind of go through some of these slides a little bit quickly on the front end because Amy's talked about some of these things and there's some introductory things that aren't as important just to kind of get us going. All right, our center. Amy's talked about that. We had a lot of great people support us in this work and help out on it. So,
You want to hide them?
yes, I do. Yeah. Thank you. Okay. All right, a lot of great people supported us in this work. Here are a lot of partners who helped us with data collection. So this particular project I'm going to talk about today was a measurement development project that we started back in January of 2020. Here was our overall goal, which was, in the US, we mainly use USDA's household food security module to measure food security, and I think a lot of other places do too. But we realized, and a lot of other people have thought this as well, that there's a lot more to the food insecurity experience than just what's measured on USDA's module. So our goal was, basically, what are we not measuring right now that we need to create measures for? And then let's identify those areas and then create those measures. So that was the purpose of this project. There was two main phases involved. So there was a formative phase and a testing phase. And so here were our formative steps to basically identify the gaps and then create the initial pools of items that would later become the measures. So we worked with an expert advisory group. It had both academics and then also people who were practitioners. So they might have worked at food banks or food pantries, as we call them sometimes in the US, doing community work and implementing programming. So kind of you had those two perspectives. And then we did some literature scans to basically confirm these are the gaps in the literature where we don't have measures. We worked with the expert advisory group to kind of prioritize those gaps and, we can't address all of them. So, what were the top three we wanted to focus on? And then we found items in the literature, modified some existing survey items, and then also created some new ones where we couldn't find anything that we could use. And then we basically took all of those items that we found and that we prioritized, and we went through, we did some, I should back up, I missed a step, but we did some formative interviews is what we called them, where we interviewed about 50 people throughout the US who were experiencing food insecurity to understand their experience and to look at what are the themes that came out of those interviews and make sure that our measures were covering those themes. And then once we felt pretty good about the items and that they covered the themes that we saw in the interviews and that the expert advisory group felt they were good and that we felt good about them, we then did some cognitive interviews where we had people who were experiencing food insecurity go through the items and they called it the think aloud approach. So they talked us through their thought process as they were answering the questions so that we could make sure that they were interpreting them in the way that we thought that the question should be interpreted. And they also helped us with some changes in wording to make sure things were a little bit more understandable. And they also helped us prioritize some of the items where they were like, this item isn't very good. I really like this item better than that item. Let's cut it. And that was kind of an iterative process. You can do like one grouping of interviews. They find all the problems, you fix them. You do it again, you find more problems and you fix them. And eventually you don't find any more problems and then you stop. So that was the formative phase. And so here were the three main measurement gaps that came out of that formative phase that we wanted to address. So we have household resilience gap, the perceived availability, utilization, and stability gap, which you may notice those are three of the pillars of food security, and then the nutrition security and dietary choice gap. And so we ended up at the end of this project, which I'll show you some of these later, but we ended up creating and validating 9 new measures that fit across these domains. And each of these domains has 3 measures that fit within it. It just happened to work out that way where there was 3 for each one. And one thing I just like to point out is that the 9 measures are all self-reported survey measures, and they're all independent. So you don't need to use all 9. That's a question I get a lot. There's no reason to use all 9. You just pick the ones that are most relevant to your study's aim or whatever the project objective is. All right, so I'll start going through household resilience. So household level financial shocks like losing a job or high unexpected bill is a major risk factor for becoming food insecure. There's some research that shows that a financial shock equivalent to about $500, which is about 1,700 shekels, is associated with a 20% increase odds of that household becoming food insecure. So these measures all aim, the measures within this gap area all aim to assess a household's resilience against becoming food insecure in the face of a financial shock. So when we were examining resilience at the household level, it's a relatively recent idea. There's been some work in the international space of folks, especially folks associated with the FAO, who were looking at household resilience in the context of food insecurity. And they defined it as being related to these 3 capacities you see here on this model. And so in trying to explain this in the past, I would just read off the definitions of the capacities, and it didn't really resonate with people. So we made a model here, and I hope that, and I'm gonna go through this, and I hope that it'll make the concept a little bit clearer. So, you know, you can imagine a financial shock at the top coming down on a house like rain would. And just like a house, your first line of defense is your roof. And so in this case, it's absorptive capacity. So your absorptive capacity are things like resources that you have on hand, friends or family that you can call on for support. They're all the things that you can use in the very short term that you have on hand to buffer against a financial shock. So, you know, if you have a really high unexpected bill of $500 or more, if you have savings, then it's no problem. But a lot of households don't have any savings, and it's a really big problem for them. So that's your absorptive capacity. And then say your absorptive capacity gets overrun, you then have to go call in your adaptive capacity. And so this is a little bit more in the intermediate term. And these are all things related to the people in the household. So that's why it's in the center of the household in the model. So it's things like knowledge, skills, financial efficacy, not having barriers to getting a job. A common example I'll use in the United States, if people were convicted of a crime, that'll stay on their record for a really long time, even though you may be reformed, you may be an adult now, you'll still have that on your record, and that can limit the number of jobs you can apply for, even though that's not visible to someone who may just be looking at you. It's a barrier that you have. So things like that are related to adaptive capacity. And then next is transformative capacity. And that's all about factors that are related to the community that the household is situated in. So good job availability in the community, resources, infrastructure, transportation options, the social environment in the community. And these are all things that can limit a household's ability to build resilience in the long term. So that's kind of how all of these 3 capacities fit together. And so we created measures to address those. And here are the measures. I won't read this again because I kind of already explained it, but I'll show you a little bit more later. So these are the 3 that go into the household resilience domain or gap area. And so we had one measure for each of those capacities I talked about. And then so the next one is this perceived availability, utilization, and stability gap area. And so for this one, you know, there are the 4 pillars of food security. So you have availability, which is just, is food there? And then the next level down is accessibility. So food may be there, but I need to be able to access it. So I need to be able to afford it. I need to be able to get to where the food is. Then the next level down is utilization. So food is there, I can access it, but then can I, like my household or me personally, can I actually use the food I have access to make a healthy meal? So I need food preparation equipment. I need to know how to cook, those sorts of things. And then stability is the 4th one. So all of these things can vary over time. So you might be You might have some of these issues at a certain part of the year or a certain part of the month, or you might have chronic issues. So it can all vary over time. And here is a figure just showing how they fit together. And USDA's household food security module really gets at accessibility, as I think I mentioned earlier, especially from a financial point of view. So, but it doesn't really hit on these other three pillars at all. And that's true for most measures that are out there across the globe that are being used. They mostly focus on this access pillar. So we wanted to create measures that get at the other three. So sometimes we just call this the other three pillars gap area. So we created measures that get at the utilization pillar, the availability pillar, and the stability pillar. Here are those three measures. One thing to point out here is that we also used the very similar wording that USDA's model uses, and the same response options and the same scoring approach. So that if you wanted to, you could use all four at the same time. You don't have to, but if that was important to your study or your project, you could use all four at the same time. And then the last one is nutrition security and dietary choice. Here's just a model showing how some hunger concepts fit together. And you can see on the far right is nutrition security. When we started this project, the definition of nutrition security wasn't established in the US. There's a lot more momentum currently in the US around nutrition security versus food security. So, but when we started this, that wasn't there. So we did have FAO's definition. There's a couple other international definitions as well. Some of them didn't really fit to the US context or didn't seem to as much. So we relied a lot on those formative interviews that I mentioned earlier to come up with our conceptualization of nutrition security. And then also some of the literature. So this paper, for example. So we knew that nutrition security was a bigger concept than food security. It encompasses food security, but then also there's this emphasis on health and quality foods that support nutrition. The USDA's definition is here. So they do now have a definition. This is it. It wasn't around when we started, but what we arrived at does fit pretty well, just by coincidence. So that was good that we're kind of thinking in the same direction there. One other thing I should point out here is, so you'll notice that top bullet is the nutrition security measure. These are the three that were created in this particular for this domain. The other two there are not nutrition security, but related concepts. And those really emerged from our formative interviews where we were talking to people about their experience with the nutrition security. And one of the themes that really came out was people felt like they didn't have a lot of control over what they could eat. They didn't have a lot of choice. And so we heard from a lot of people that they would go to their doctor or their dietitian or nurse or whatever it may be, and they would give them great advice. Maybe they have diabetes and they give them great advice on, you need to eat, fewer carbohydrates, more protein, more high fiber food, those sorts of things. And they would be thinking, that's nice, that's great. I can't really do that. I don't have control over what I eat. So there's this disconnect between, okay, you're getting great advice, but you can't actually do it at the household level. Because a lot of people that we talk to, they may have a low wage job, or they may be getting welfare from the government because they have a disability or whatever the case is, so they can't work. And that just covers their rent and their bills. And then oftentimes they have no money left after that. So they might get food stamps or SNAP, where they get some money from the government. But if they don't have any children, and if they're elderly, a lot of times it's only $15 that they get for a whole month. And so that doesn't really do anything. So they're really at the mercy of whatever's at the food pantry or the food bank. So they didn't feel like they had a lot of choice. So these last two were really to try to measure that concept, was how much, the second bullet there is about how much control do you feel like you have over the healthfulness of your diet. So can you actually, if you wanted to, have a healthy diet, or do you have too many external limitations that prevent you from doing that? And then the last one there is just general dietary choice. So that's just, do you feel like you have the ability to make your diet whatever you need it to be? So you might have certain religious or cultural needs for your diet. Can you actually meet those needs? You might have certain dietary preferences that you need to meet for other reasons. Can you actually meet those needs? So how much control do you have over your diet? Is that last one. All right, so now I'll get into the testing. So I talked about the formative phase and kind of developing our conception of what the measures were. And then we needed to actually test them and see if they worked. So here's the testing phase. And there we have 2 papers in review and one that just recently got accepted. It's in the top right corner. And this will go into a lot more detail if you want to go to that citation, and it's open access. Anyone can go and download it. I'll go into more detail in the formative and the testing phase than I have time to give you today, but I will go through some of the findings. So basically our approach was that we took the pools of items that we thought fit each of our measures and each of our domains, I should say, our measurement gaps. And we piloted across 5 states in the US. So we had about 1,000 people respond to the survey. And we worked with some partner organizations that had reach into communities that had food insecurity issues. That was some of those groups I showed on one of the earlier slides. They helped us collect the data. And we ran some psychometric tests to decide which items to retain, and also to look at factor structure and some other tests to make sure the measures worked, that they were valid. And I'll go over some of those findings today. All right, so first I'll kind of go through in the same order I went before. So I'll do all the household resilience stuff, then I'll do all of the other 3 pillars, and then the nutrition security. So this is household resilience items. These are just some example items just to give you an idea of, what we were actually asking people. One interesting thing to point out with these items in particular for the household resilience side, this isn't as true for the other ones, but it is true for this one, where you get a lot of practical information from these measures. So you not only can score people or households on whether they have high or low absorptive capacity or whatever it is, you also can see a lot of things that are holding them back from having high or low absorptive capacity. So you can score them, but then you also get information that you could use to form an intervention. So you can see, well, what are the actual expenses that are burdensome for the household, or what are the actual job barriers they're facing, or what are the barriers they're facing in being able to access government programs. So you can get a lot of information that way out of the items. Here's the pilot sample for the household resilience items. You can see there mean age of about 44, but there's a big range in ages. About 2/3 had experienced a financial shock in the last 12 months. About 3/4 were women. 2/3 had low or very low food security. So this is a high food insecurity sample. About 40% had a high school diploma or less. So on average, these households had lower education levels. And it was pretty racially and ethnically diverse for the US. So a pretty good snapshot, we feel like, among for households that are food insecure or at risk of food insecurity. Here are the exploratory factor analysis findings. So items that loaded at 0.4 or below, or 0.4 or above were retained, and items that were either loaded low or were ambiguously loaded were dropped. So we use this step to look at the factor structure and then also to drop bad items, basically. So you can see absorptive capacity, it has just one factor, and it's a lot of items measuring the financial well-being of the household. And then for adaptive capacity, it has 3 factors. So basically that measures looking at 3 different sort of related concepts, where we have a lot of things around skills and knowledge and barriers. Then the next factor are stress. So experiencing financial stress can inhibit a household's ability to act. And then the last one is about social support. So this one really gets at things like knowledge, skills, efficacy, also not experiencing a lot of stress right now, and then having people who you can rely on to help you navigate situations. And then the last one, transformative capacity, also has 3 factors. And so it has a lot of things around basically what are the resources in the community that could help a household get a better job or advance, things like education, job opportunities, good healthcare, transportation, things like that. And then the second factor is all about future financial outlook. So basically what's their outlook for the future? And then the last one is all about the social environment in the community. So this just kind of gives you a good snapshot of what are these measures actually looking at. Here's some more information about the testing. So all of the Chromebax alphas were in acceptable range. So that just tells us that they have good internal consistency. So they're measuring one concept when they are measuring things. Let's see. Another thing to point out here is just that the scores can all be calculated really easily. So you don't need any advanced statistical software. They're just mean scores. So you just take the mean of responses and that's your score. We also created brief versions for all of these. So they're kind of long. So you have 9 items, 18 items, and 16 items. And if you were doing like clinical screening, some of the things Amy was talking about where they screen for food security at the clinic, you can't use 18 items. You can't even use 9 items. Yet you have to be very short. So in case someone wanted to use these in applications like that, we created really short versions that could be used for screening at clinical settings or other intake, other settings where people may come in and you want to screen them for risk. Here's a correlation matrix. Basically, you have the measures there on the left side, and across the top are other variables that we hypothesize the measures should be associated with if they're valid. So we're looking at content validity here. And you can see that if you go across the top row, you're looking at how absorptive capacity is associated with all of those different variables. And then adaptive capacity and then transformative capacity. And those variables we're looking at are food security. So that's USDA's module. General health was an item from a US survey that the CDC uses. CD risk scores, that's another scale that's already in the literature that looks at how someone handles general challenges. So it's like general resilience. And then financial well-being is a scale that a government institution in the US uses that we use for this one too. And then financial shock. So have they experienced a financial shock? And so for all of these, people who scored higher were more food secure, they were healthier, they were better able to handle a general challenge. Their households were better off financially. They had more financial well-being, and they also were less likely to experience a financial shock. So those were all in the directions we expected. So we think that they have good content validity. So they are measuring what we think they're measuring. Now I'll go through the other 3 pillars measures now. And again, here are the some example items you can see. These one thing I like to point out here that was kind of interesting. You'll notice at the top left you have limited food store availability. So that's at grocery stores basically, or any other place you go to buy food. And then limited food pantry availability. And so that's at food banks or food pantries. In the US, we usually call them food pantries at the community level, and then food banks are at the larger level. But so the reason we split those in 2 was due to those cognitive interviews. So we had a really interesting finding here where originally how we were going to measure availability was we were going to ask people about a 1 mile radius around their house and ask them if healthy food, there's a couple of different healthy foods that we're asking them about, if that's available in their 1 mile radius around their house. And there's a couple other scales in the literature that use that similar approach. So that's what we started with. But people in the interviews were saying, well, I don't really know. I only know about the places I go to. So we changed it to be about the places that they go to for food. And then people said, well, I really think about food pantries differently than food stores. It's really hard for me to think about those 2 things and answer your questions. So we split it off into 2 different ones. So there's one for availability at the food pantry and one for availability at grocery stores or other types of stores they may go to. There's also some pre-questions where we can get a sense of what types of stores they actually go to and what types of food pantries and similar outlets like that they may go to. But that's why we split that. And then the next one is utilization barriers and food insecurity stability. Oh, one thing with the food insecurity stability is how we approached that was, so in USDA's module, there's the never true, sometimes true, and often true are the responses. And so when someone says sometimes true, we don't really know what sometimes means. So these items for food insecurity stability are defining what sometimes means for them. So if they say sometimes true, we have all of the items that we created are follow-up items. So they're meant to be tacked on to USDA's module to follow up those questions. So if they say sometimes true, they get skipped to a question that says, well, what basically says, what does sometimes mean? It's not worded that way, but that's basically what we're asking. And they have options for the 4 seasons, 3 times of the month, and intermittent. So basically randomly. So that way we can get a sense, we can give each person a score for their chronic food insecurity, their level of seasonal, intramonth, and intermittent food insecurity. The sample is really similar for all of these because they were all from the same process and recruitment process, so I won't go through the sample again. Here is the factor analysis findings, and they broke up basically how we thought they would. I have about 5 minutes left, so I'm gonna go a little bit faster. One of the interesting things I'll point out here is just for utilization barriers, they broke out into tangible barriers and intangible barriers. So tangible barriers are things like, do I have cooking equipment? Do I have a sanitary place to prepare meals? Do I have utensils to cook with? And then intangible barriers are more things like cooking skills and having time to cook and things like that. All right. Here are the just kind of overview. Again, good internal consistency scores. We looked at test bias too for all of these, but I won't get into that. I can tell you more about how we address that and if you have any questions afterwards. And then we created a 2-item version for the utilization barrier. So that one does have a screener version. The other 2 were already short, and because of how they were formatted, it didn't really make sense to do a short version, but we might revisit that in the future. Here's the correlation matrix for those, and they were in the directions expected again. So we felt like they had good content validity, at least for the sample that we tested them in. And now nutrition security. These were, again, remember we had the nutrition security, healthfulness choice, and dietary choice kind of in this domain together. Here's the sample. Again, it's going to be very similar to the other sample. The factors here broke out where we had the just general dietary items. We had our nutrition security items, which are these 4 at the top on factor 1 on the right side are the nutrition security items. And then factor 2 on the right side are the healthfulness control items. Again, good scores here for internal consistency. We looked at test bias as well. And then each of these has a 1-item screener version. So each of them has just a 1-item version that can be used for like clinical screeners or other types of intake screening. Here's the correlation matrix here. So people who scored higher were more food secure. They have better health, ate more fruits and vegetables, ate more scratch cooked meals. So that's scratch cooked meals in the US is like you make it from scratch, like just from basic ingredients, like it's nothing's pre-prepared. And then no association with fast food meals. But there was an association with decreased processed meals. So that'd be anything that you might get from like a TV dinner, like a frozen meal, something like that. We also took this analysis one step further because we kept getting the question, well, how do we know that your nutrition security measure is giving us anything better that we're not already getting just from measuring food security using the USDA's module? And so we looked at that by, these are all, and I know you can't see this, I'll zoom in on the next slide, but we wanted to look at, okay, well, how is our nutrition security measure associated with 4 different health outcomes? And also we had 4 different dietary outcomes. And then is that association still there when we control for food security? So we take food security out, can we still see associations? And then we also further control for all the sample characteristics. So basically we're saying, we're taking out variation. Yep. Oh, okay. we're taking out variation due to food security, and we're taking out variation due to sample characteristics. So basically, above and beyond those, do our measures still show association with health outcomes and diet outcomes? And so we did show that a lot of things were still significant. If you look on the far right model 3, that's the one that controls for food security and controls for sample characteristics. And this is the nutrition security measure. So you see, even people who, even after you've taken out food security and sample characteristics, you can still detect risk for general health, hypertension, diabetes, and also scratch cooked meals were still significantly associated. So basically, there's still added benefit to asking about nutrition security in addition to food security. Potential applications, we think they can be used for needs assessment, program evaluation, social risk screening, so at the hospital or even like at a food pantry, and research and surveillance. I'll just do this example. I had one other example, but I'll just do this one. But basically, this is a project we're working with a hospital that has a big community presence. So they have hospitals, and they also have a lot of food pantries in their community that they can refer people to, and they have some other services and programming. But they do a lot with their community, basically. And they screen for food insecurity at their hospitals. So everybody gets the 2-item hunger vital sign screener. And if they screen positive there, so they answer, if they answer in the affirmative for at least one of those items, then they get referred to one of the community food banks or food pantries. And once they get there, they use some of our screeners to then further screen people for nutrition needs. So they have the nutrition security screener, healthfulness choice, and the utilization barrier screeners. So they give them those questions when they get to the food clinic or the food pantry. And if people screen positive there, they then have, they refer them to the dietitian who will help them with personalized nutrition counseling. And they have a program set up to help households to address their needs for preparing healthy meals. So they might have some of those tangible needs, they might have some of those intangible needs. So they get helped out in that program with addressing those needs. So they get referred to that program if they screen positive. All right, and that's all for me. Thank you very much. And here's a website you can go to where all of our measures are there, freely publicly available. You can pull them off. They're in English and Spanish and Mandarin right now. We also have a lot of users guidance and some other accompanying materials. And then if you have any other questions we don't get to, it's my email if you ask any questions. So thanks.
Okay, thank you, Eric. Although we are behind on time, we have some time for questions for either Amy or Eric. So please limit your questions first of all to the situation in the US while we have them here. Later on, we can talk about the situation in Israel. And just to remind you that the question is defined as a short sentence with a question mark at the end.
So asking about the US, but with the eye on Israel, so there is a changing political throughout the US. How do you see keeping the professional approach and making sure that the measures developed and the tools developed and the entire strategy is staying after political changes?
It's hard for me to answer for the Israeli context, but in the US, the USDA has adopted the food security module, and they've clinged onto it, and that's what they use and what they promote. And so because of that, we've kept that module for the last 20 plus years. So I think whoever is in charge in Israel, whichever department of that measurement, as long as it's something they believe in and they buy into and that they promote, I think that that's how you keep those measures in practice. And because it's been in practice for so long in the US, we've gained so much knowledge about food security throughout the years because everyone uses the same measure. They've been using it for 20 plus years. And so there's a lot of ways to compare. It may not be the perfect measure, but we can compare across time and across studies because everyone uses the same measure. So I think getting buy-in from whatever that group is that would be in control of promoting what the measure is used in Israel would be important. So making sure they're involved in that process of deciding that, I think, would be important.
You ask about the measures or the program?
Just both, right? So I'll just say USDA, they really now in this administration are very invested in nutrition security. The idea that, but there's conflict actually, because believe it or not, there's some groups in the US that like the old terminology of food insecurity. And it's mainly through food banking because they feel like there's going to all of a sudden be put restrictions or national organizations, anti-hunger organizations. And they think that next that is going to happen is that they're going to restrict SNAP, but like say, no sugar sweetened beverages, new SNAP. So there's this divide with the public health community, which we're in, and others are embracing the term nutrition security because it's the idea that someone who's hungry or food insecure gets nutritious food. It's not just any kind of junk food. And so I do think the administration has now put their eggs in that basket and they're going to stick with it. Now, if another administration comes in, I think it'll be hard to undo all that's being done with nutrition security because it really is gaining a lot of traction. All their talking points. I've been to a lot of different presentations. All their talking points are around nutrition security. They're all in on.
So, first, great stuff. I think one question that comes to mind is that if I look at your measures, it seems that to inform more effective policies to leverage the impact of the program, you need to think more holistically on a lot of operational and logistic challenges. And that also involves other organizations than maybe the organization to just deliver the financial incentive. So I wonder what are your thoughts about how do you bring together the policy and the policy elements and policy values that affect the overall elements that you need to put in place?
This meeting, it's getting all the people in the room to have the dialogue. I mean, I'm being serious, but I mean, just the idea that, food banks and having the presence of food banks along with any healthcare and, that side of things, and then having government and having, any other NGOs. I just think it's getting all those in the room. And sometimes maybe one group could be more of the funder, another time maybe another, but just the idea of the buy-in of doing work in this area to even get any pilot projects started. And then from that, I think, it could take off.
It's very difficult in the US, especially when you get the political side involved, because there's, here too, I'm sure, very competing priorities on either side of the aisle. And so, I think advocacy is really important. We don't really have a lot of knowledge in advocacy where we work, but political advocacy, I think, is important to, that whole sector, getting them more involved in what we're doing. Because they can help move political agendas to favor some of the work that we're doing and other people in public health are doing. And then, once we have political buy-in, then the funding comes and some of these programs can happen. But I think, I agree that they all need to be working together, but I don't know how to do that.
And the next farm bill is coming up and it'll be very interesting to see what ends up in that farm bill. I do know that at the White House conference, the food is medicine and nutrition incentives were talked about a lot. And so they said more money into GusNIP and more money for food as medicine. So again, this is where I think, I started off as an individual level behavioral scientist and now working on policy systems and environmental approaches. And I do feel like going out to the environment and policy level to affect more people is where I think this is all going.
You're mentioning the USDA. Is the USDA and the Farm Bill is the only stakeholder of the program?
For GusNIP?
Yeah.
Yes. So for
It's the
GusNIP,
only funder, right?
It's funded through the USDA, right?
yes.
Yeah.
But I will say that it's, I mentioned that I used to be at the NIH and I was at the National Cancer Institute, and years ago, there was no interest in food insecurity. Like one of the reasons I actually left was I was very interested in working in food insecurity. And now I feel like the NIH is interested, CDC, our Centers for Disease Control and Prevention. So we have a lot of federal entities that are interested in food insecurity, social determinants of health. But USDA right now, they're the funder of the Gus Schumacher Nutrition Incentive Program, GusNIP. But there are other ancillary forms of funding that could, just help elevate GusNIP because there are other things going on around the country. I will say at the White House conference, another partnership that was announced was between Kroger, which is a major supermarket in the United States, and then American Heart Association, a major NGO, and then Rockefeller Foundation, who's been interested in in food as medicine, and they've been funding in this area. They're committing another $250 million over the next couple of years to work on food as medicine. I did talk to someone at AHA because we do work with American Heart Association and said, well, what are you going to do that's differently? They said, we're going to have to map it out and make sure we're not conflicting with some of the stuff you're doing. I said, just use the same measures, please. Like, we want consistent measures across these various projects so that we know in the end if we're really affecting any change.
Okay, so thanks again, Amy and Eric.
Ta-da.
It was very enlightening, and I'm sure we have a lot to learn from your experience, and I'm sure your website will be overloaded with entries in the next few hours. So let's take a break until 11:10. And meanwhile, I suggest that anybody who's speaking in the next session and will put his presentation on the screen here, and those who sent them before, make sure it's here. Okay, so we have a session. The second session is a series of short presentations of Israeli organizations that are dealing with security. And because these are really short presentations, please keep your questions to the end. We'll have time for that. So the first one on the list is Miri Endeweld from National Insurance Agency Institute, right?
Thank you. I apologize first that I should leave earlier, and then that I didn't prepare myself to present in English, but I will do it in a mixed way. But anyway, the slides are in English, so so my name is Miri Endeweld. I'm from the National Insurance Institute. And I am the head of Economic Research Department at the Research and Planning Administration. And I will present our experience in the measurement of food security in the last decade. Since 2011, the Research and Planning Administration and the National Insurance performed 4 surveys of food security in the population of Israel, according to the food security survey of the 18 questionnaire of the American Ministry of Agriculture. The surveys were done in 2011 and 2012, separate samples of about 5,000 families each one. And then in 2016, we returned to the same families, and again in 2021, to the same families of 2011 and 2012. So that we have 3 points in time, and the possibility to conclude about the permanent phenomena of food insecurity. The surveys allow us to identify the situation of the food security in the different groups of the populations in Israel, like Arabs, ultra-Orthodox, etc. The sample is a random sample. The sampling was done on families, and a family is defined as an individual or a couple, married couple, with or without children. And this is according to the data from the population register. In most cases, the interviews is the head of the household or the spouse. Some example of the question in the questionnaire, of the 18 questions questionnaire, I suppose that most of you are familiar with this, but I just want to present some examples. One of them, the food, they should say if it is the situation in their household in the last 12 months. In the food that we bought just didn't last, and we didn't have money to get more. Another question, we couldn't afford to eat balanced meals. Were you every hungry but didn't eat because there wasn't enough money for food? In the last 12 months, did you ate less than you wanted because there wasn't enough money to buy food, and etc. And the definition is the questionnaire is subjective, as you see, and each family has a score according to their answer. And we have 3 or 4 groups of food security or food insecurity, severe food insecurity, moderate food insecurity, and the family is in food security. Just several findings from the last survey of 2021. We found that the food insecurity in families of persons and of children were 16% in 2021 in families, about 70.5% in persons, and about 20% in children. In each of this group, about half of this person was severe food insecurity, was in status of severe food insecurity. And here we can see the population groups and their level of food insecurity. And as you can see, the highest level is of the Arab population, about 40%. In 2016 and in 2021, in the other groups, in Jewish it is about 13%. In Haredi Jewish, it is in 2016 it was 23%, but it declined in 2021 to about 15%. Okay. And here we can see the correlation between the income of the household and the food insecurity. As you can see, it is very correlated, especially in the case of severe food insecurity. Now you can see also the permanent of this phenomena, and we see that in about more than 90% of those who were food security in 2016 remained food security in 2021. But about half were food insecurity in the 2 periods, and more than 1/3 were severe food insecurity in the 2 periods. That's all. Thank you.
Thank you, Miri. And now Yafit Alfandari from the Central Bureau of Statistics.
Hello, my name is Yafit Alfandari from the Central Bureau of Statistics. I'm in charge of developing gender, economic, and social data in the Bureau. And I would like to present a paper that my colleague Tzila Sadeh, Roen, Tzila, and me wrote about the healthy lifestyle among distals in Israel. So before I jump into the research, I think that I don't need to convince you that the complexity of poverty in the modern life is not is very complex. It's not just food insecurity. It's not just ask for food, but it's worried about the cost of living. It's the neighbor next door. It's prioritized, and that was our motivation to do this research, to level up from the food insecurity and to explore what are the habits, the healthy habits of households in Israel. So the purposes of the paper were to expand the scope of poverty, healthy lifestyle in a developed country like Israel, and to explore the multidimensional poverty, and to expand the product classification. In Israel, we use the international classification for products, like in the United States and all over the world. And our purposes were to expand the product classification by its nutritional components, proteins, carbohydrates, fat, and dietary fiber. And the poverty measurement is a very complex, and we are ordered as a developed country to research the poverty as a multidimensional phenomenon. So there were a lot of measures and pillars that mentioned across the multidimensional poverty, and the lecture is talking about the living standards, education, and health, and also the sustainable development goals talk about no poverty, zero hunger, and good health and well-being. All those subject pillars connected to each other. So what we wanted to do is to research not only food insecurity, but as I mentioned, to research healthy lifestyle, diet and nutrition, and sport activity, and to see what is the long-term damage or damages to society and public resources to involve to enter this subject. Before I jump in the research, a little bit economic indices in Israel. The Gini index, Israel is leading negatively lead at the Gini index. The inequality in Israel is very high. The power purchase party in Israel is very high. The cost of living in Israel is very severe. The poverty rate in Israel also very high. 30% of the households in Israel are poor, comparing to the 20%. Yes, but this is according to the OECD measurement. No, according to the OECD measurement, it's more than 20, because we adapted the definition from the OECD. And in the OECD country, the poverty rate is about 20%. The tax burden also in Israel is very high. Mostly the VAT tax, MAM, in Israel. And all this this is very affect the lowest decile in Israel and the poorest. Also a picture of the household composition by deciles in Israel. is the percentages of families with children and no children. And as we can see in the lower deciles, we have more families, households with children. In the top deciles, here, we have less families with children and more persons aged 65 and above. This is the composition of the household in Israel. The size of the households in the lower deciles is very high, is about 4.2 persons in households, and in the high deciles is about 2 persons. So, what were the data sources for our research? We use 2 data sources. We use the household expenditure survey. This survey conducted annually in the Central Bureau of Statistics since 1997, every year. It examines households and individual expenditure at all ages, income, ownership, durable items, and housing. The target and the aim of this survey is to assess the consumer price index, the GDP, the consumption part in the GDP, and the poverty threshold and the Gini index. This is a mandatory survey in Israel, and it's cross-sectional. Every year we change the sample. We also used in our research the social survey. The social survey conducted in Israel annually since 2002. It includes persons aged 20 and older. It examines lifestyle, subjective questions about our life, how is your condition, and it provides up-to-date information on the welfare of the Israeli population and its living conditions. This is also a mandatory survey and cross-sectional. Every year we change the sample. So what was the method? In the household expenditure survey, we collect the products and we take from the survey almost 300 food products. And we gave each food product nutritional values. What is the amount of the proteins, carbohydrates, fats, and dietary fiber. The data was collected from experts. We used the experts and via internet research. We also collected prices per 100 grams of product, and the fluid were converted to grams. And for the average price of product, the most popular product was taken. This is an example of column like wheat and how it is divided to proteins, carbohydrates, fats, and dietary fiber. And for example, how many slices bread does one person eat in a month? So this is the calculation, and 33 if you ask yourself, 33 per 1 person. We had some, of course, research limitation. This is a proxy, not directly measuring food consumption for each person. So we cannot do it by gender or by age. We research all the household, whole household. We can't measure the food wasted by households. There are price differences, location and the store type, but we took the average price. Not all the components were considered, like sugar or types of fats. We didn't take meals at restaurants, cafes, and of course, we need to expand the definition of healthy lifestyle to hygiene, air pollution, waste, living condition, and etc. So, three of the main findings: the amount of food per person is higher in the top deciles than in the lower deciles. The lower deciles suffer from food insecurity, as we saw from Miri. Also, it seems that the food waste is higher in the top deciles. As I mentioned, in the top deciles, we have the size of the household is smaller than the lower deciles, and we can see the deviation of the pasteurized products, milk products, and the other food products. This is the consumption by grams. Second finding is the consumption of healthy food is popular among the highest decile. Lower deciles consume more refined white wheat, sweets, sugar, and soft drinks. And we can see it in here.
It's cheaper.
Some of it cheaper. This is a consumption of healthy food, for example, fresh vegetables, fresh fruits and fish, and this is the consumption of bad food products like soft drinks, potatoes, oil products, and the sugar products. And you can see here that there is no difference between the deciles, and here is clarity in the differences between the deciles. Also, a main finding in our research is we find very small differences in products nutrition components among households and deciles. We took a cluster regression and we didn't find differences, but we recognized 4 types of households. Type 1 is 8% of the population. Okay. The carbohydrates are 80% of is diet, and this is the other components. The second type, half of the population, 65 of them consume carbohydrates and 16% proteins. The 3 type. And the fourth type is this is a new word, the catabolic household, I think. The amount of the percentage of carbohydrates is very low. What about exercise? As the deciles increase, the percentages of people who exercise increases. You can see here. Conclusion: poverty is not only food insecurity; it is also the lack of healthy food. There are differences in food products, but not in food nutritional components between higher and lower income. One of the findings is about the food waste across the deciles. This is more common in the higher deciles. The population is unaware to the importance of the healthy lifestyle, especially in the lowest deciles. And we should talk, I think, about the long-term damage of an unhealthy lifestyle, like heart attacks, and etc. And I want to conclude what can be done. Raise awareness to social media in schools, establish public parks for exercise, for example, expand the data for policymakers, conduct time use survey to learn about the shopping habits, measuring food waste, subsidize healthy products, change the tax system, reduce VAT for healthy products. I like Amy spoke about the food stamps, that when you buy, when you get healthy food, it's doubled. And eat healthy and exercise. Thank you very much.
Clarification, did you say the differences between the groups were not significant?
By age and by geographical areas and
There was no significant.
no.
This is. Okay, the next speaker is the Mendi Blau from Eshel, Yerushalaim.
Everybody, my name is Mendi, and we're running actually the food program in Israel. In the States, the government doing that. So here, the program that there is, the food security program that there is in Israel, we're running that. We win a bit, and we're running that for the government, together with the municipalities, and together with the money that coming also from outside, from donations. So altogether, right now we have about 30,000 families in the program. And another 3,000 families are getting help for, this is a new thing, for baby formulas. So this is a new thing, a new program. And I'm just going to give you a little bit from my experience. I'm already 40 years in this field, and I'm just going to make it short, not so long. When we start, actually, we start about until 10 years ago, the government didn't want to hear anything about giving help with food. They said that there is supplement, they're receiving through the Social Security of Israel, and if it's not enough, so they should give more money. So actually, this was the ideological. It was that the Treasury Ministry didn't want to be involved, didn't want to give any money to food security in Israel. That's why, in the last 34 years, there's a lot of, it's nothing like that in the States. You're talking about tens of thousands of non-profit organizations, or thousands, nobody knows exactly how many, that went into this field and taking care of food security. A lot of them, most of them, this is like communities, religious, this kind of thing. So that's why there is, let's say, like the Arab population almost does not exist. There's no number of organizations. The ultra-Orthodox, there is too many. So it's not, it's like some cities there is a lot, Jerusalem there is a lot, some cities nothing. But this is what's happening. They came into this field of the food security instead of the government, because the government didn't want to be involved. The government decided about 10 years ago to make a pilot. Actually, it didn't want to give money for food. So the pilot was that they gave money at the end of the day for workers, for a computer system, for all this kind of thing, not for food. And we made it together with they didn't want to give the money to us, they gave the money to JDC. And that it's also not to give direct money for food. So everything just was like to be very careful. And the first thing that we start, or the first job that we got from them, it's actually to know what's happening in Israel into the food security. Because I'm going to tell you, there is here 4 people from the 4 biggest non-profit organizations in Israel for food security, Latet, Leket, and Pitchon. And we was also very, very big in those times also. I think that any information that came from these thousands of non-profit organizations, it's not true, nothing. It's mean, the all information that coming of, I'm just going to give you an example. There is some small help of the government for 2 high holidays. One is for Passover, one for the beginning of the year, for Rosh Hashanah. In Israel, there is 2.8 million households. If you take the Arabs, because they not celebrate Passover and not the Rosh Hashanah, so it's about 500,000, 550. So we stand with 2.4 million households in Israel. The people, the organization that giving names to the government to get help, it's 1.2 million households. It's 50% of the population doesn't have enough food and they're receiving help for food for Passover. Each one, 1.2 million for Rosh Hashanah, 1.2 million for Passover. this is something unreal, it's something that I'm not going to say any more words about it. But it means that any information that coming for this non-profit organization, it's not true. So even survey that making by these non-profit organizations, any information that's coming from there, that means everybody just have to give more names and more names and more names and say, yeah, I have thousands of people, I have 2,000 people, I have 3,000 people. But you see, if you're counting the people in the city, there's not so many families in this city. Okay, so this is one thing that you have to understand. So when we started 2013, so we understand that because we also not part of organization. We came from a place that we knew what's happening in the field, that you know nothing. That even before that, this was the Knesset did some research, the other one makes some research. It's nothing. The other thing, I can tell you my personal, we not believe in the survey. I know the USDA, 18 questions, all this, we not believe it. Why? We know, we have the experience that the people that in the survey, this is people that receiving now kind of help of food, or someone that calling them, this is non-profit organization, or someone that have to do with food, they know that they have to give the right question to continue to get food or to start to get food. So that means it's, again, this survey, I'm not going to say it's worthless because I know it's like something very big and very huge. And Miri and we're working with her already for 15 years or 10 years, wherever we started. But so we just start in another way to see and to make actually the government ask us to know exactly what's happening. Like how many people in Israel on high or whatever, very low food security. Okay. So actually we start with okay, you see this is Miri Enberg, she did it 10 years ago. I don't know if you remember, it was very, and actually we start, yeah. Okay, actually we start with, we make survey by social workers, okay, because we understand that the social workers doesn't have any interest to make it bigger, because you have to understand at those times, when we started the project, the social workers didn't want to cooperate with us because they say that it's not our job to give food to the people. Okay, so we understand that this kind of survey between them, this is going to be the most. We took 150 social workers because in the beginning when we started the pilot in 12 cities. Is that? And we ask them, if someone coming to you and you don't have enough money or to give them, to help them, how are you going to choose the people who you want to help? Like who's the one? What do you think? What's the criteria of giving or helping people with food? I don't think it never was published. Sometimes the measurement compass? Okay. Okay. Okay, here you see the social workers. לא, רגע. כן.
איך מגיעים לדוח הזה?
מ-2013. It's not really giving information, just giving you idea. כן, זה מה שהתחלנו את זה. לא, זה לא משנה, לא השתנה שום דבר מאז, בוא תקשיב. Okay, she gave 12 criteria. I mean, after we find out, we spoke to everybody. What do you think? Who's supposed to get help with food? So we got all kinds of answers from social workers all around in this 12 cities. So we made out 12 criteria from that, and we gave it to the social workers. What do you think? Well, what's the criteria from this 12? What you're going to give? The first one, second one, third one, and so on. So, like you see, the first one, this is the income. It's in Hebrew, but okay, the first one is income. The second, like how many people or kids in the family. Other one, this is like I said, the social worker doesn't like so much the food, so how much motivation for change they have, the family, to change the life, or to change, to make anything change to them. Too many debt to the family, trying to work very hard. There is people with disability, there is old people in the family, and so on. So actually, okay. So actually, we just find out that the income, that this is most of the supplement that's getting in Israel, it's according to income. Okay, how much income you have, how many people in the family you have, just calculate the income by the number in the family, and that's it. You get for that, you get housing, you get everything. And then when we start, we said, okay, in each one of the cities, I'm talking about 2013, but in each one of the cities, we said, okay, you're going to choose the criteria that you want. We start to give you food, start to give it to families and see who's getting that. If the right people are receiving that, if there is people that not in the criteria are not receiving that, there is people that in the criteria are not supposed to get it. And they find out by themselves that it's not real the income. Why? Because there is people, let's say, that getting public houses from the government for free. They're paying like $50. So maybe the income that they have is lower, but also the expenses that they have is lower. So you cannot make it according to the income. So actually what we did, Miri and Professor Chernyakhovsky that passed away, he was the head of the food security, national food security, they made a criteria. And the criteria, it's actually, I can show it to you in English, and later you can see it, but this is the criteria that they made. I don't know if you're going to be able to see it, but actually, but many things, we took the whole income of the family, we took expenses that she wrote it, all or nothing, like must expensive that's supposed to be, like housing expenses, electrician, municipality, property, tax bills, expenses of medication for chronic or ill families in the debt payment, if there is הוצאה לפועל, what is called in Israel that you have to pay, there's a court saying that you have to pay. And then after we took off all these expenses, we took the rest of the money that left from this income and we calculate the computer thing for making that, calculate by how many people in the families, and according what the statistic bureau decide, like how much money they're making, they're spending on food. And if we see that this money is not enough, okay, so we know that they have to skip meals. Now, could be people that decide that they better for them to skip meals and they decide to buy car or to make another expense that it's not must. So, but we don't care about that. I mean, we don't think that the government is supposed to help for someone that doesn't know how to calculate his money. Okay, it can be someone, I'm not going to say rich, but it could be someone that has enough money and just doesn't know how to calculate that or how to what to spend or is spending more money on something that is not supposed to spend. So actually, this is until now, until a year ago, this was the criteria. We made two kind of pilots with the government of Israel. In the beginning, it was, like I said, 12 cities, after that 24 cities, after that 46 cities. Just like 3 months ago, the pilot finished, and we just start to make the program all around Israel. It's 237 or 229 cities. This is all around Israel. And it's a lot. The money went a lot, the budget went a lot higher. Again, it's not enough. But if we're taking off, Miri did it last year, actually, to calculate how many people like that we have in Israel. Because if we're talking about the survey that Miri spoke about it and she made, and we're taking off, we're not talking, this program, it's not for all people. Okay, this program, this is family with kids. So if we're talking about this way that she showed, like how they measure the food security, there is 219,000 families that are on very low food security. According to the way that we measure that, it means the income and expenses, there is 150,000 families around Israel. I believe that the 150 is more correct. And if we only write down the 40,000 families, so we're not far away to give to 150,000 families in Israel enough food security. It's not that, I'm not going to tell you it's enough, but it's enough to take them from very low to maybe low, to take them higher. To be able to take them at all, so it's have to be more like the footsteps, the American footsteps going according. Right now, everybody getting the same help. Even a big family is getting the same as small family. So for small families, it's taking them out, but the big family is not enough. So if we then put a little bit more money and make the difference between big families to small families, so I think this is the number, 150,000 families in Israel that have a problem with security. Thank you so much.
Thank you, Mendi. And the next speaker is Eli Cohen from Pitchon.
Hi, good afternoon. I'm going to try to be brief. I was asked to speak about what someone called earlier dairies vouchers. So whatever the name is, I'm going to speak a little about it. For those of us that are not from Israel, I'm going to say it's a little bit of a state secret. We're not allowed to publish many of the numbers because of the agreement with the government that operated the voucher. So I'm going to only speak about what we can talk about here. Okay, first thing I would like to speak about is the poverty line in Israel, okay? Because one of the most important things that this project has done is that it circled the problem. My friend Mendi spoke about 1.2 million households that are being reported as in need for food. But if we take the poverty report, we can see that it is actually 252,000 families that have some sort of problem with food. And what the project of the voucher did is it circled the families that are the most in need. Before that, we're going to speak about what was here in Israel before this project. And this is when we talked about SNAP. Earlier in the US, we talked about over $100 billion, which is approximately 1.5% of US federal budget. Okay, in Israel, here is the expense of Israeli budget on food, according to before the project of the voucher. This is actually translated to 0.0002% of the Israeli budget. This is the investment of the Israeli government in food before the voucher project. At the same time, in the same year, this is what the NGOs contributed to that effort. You can see that it is much higher than what the government put in order to handle that problem. And what that project has done, it gave up a big boost. Okay, actually, even if we'll take that money, even after putting this money to, and if we look at it in with the Israeli budget in general, we can see that it made it 0.0002%. It's still less than, a lot less than 1% of the Israeli budget. Even after putting in that 700 million shekels, and you can see who it handled. The first thing we can see is that one, 345,000 families. It can be a great answer to Mendi what you talked about. If the Israeli government will be,
But this would include
everyone. Yeah. But if we can take that number as a plug-in number and start as general. A general idea of the government to handle this population, that then it narrowed down the problem from 1.2 to 350. Also, what we can see here about the population is a lot of them were not treated with the project that Mendi talked about, Meizam Lebitachon Tzunati. So it's not exactly the same families, and if so, then the project that Mendi spoke about is talking about 30,000 families, which is less than 10% of this project by dairy. We have operated the project with part of the country was operated by Pitchon, and part of the country was operated by Mendi and Eshel Yerushalaim. What I'm going to speak about is only regards to what Pitchon has done. The main problem was with was data. Okay, the list that we got in Pitchon, less than 40% of them were correct. So the first effort was to find the families. The problem is that the government really doesn't even know those families. They don't know how to connect with them. And the first thing we should have done is to find out the families and look at the final number. Before, if I said 30%, only 40% where with correct data, we managed to bring it to 94% and see that most of the money is have been used already. Two things I'd like to emphasize. First, I spoke about the data, and the second one, there was a lot of talks in the Israeli public about the sectors that got help. I'm not at liberty to publish the numbers, but generally speaking, I can tell you that if we take each and every sector that got out of this project, no sector got more or less than 8% of the ratio of that sector in the poverty report of the Israeli government, meaning it helped everyone according to the rate in the poverty report published by the Israeli government. Miri has left, their institute is publishing it, so that is the number in general. Another thing that was important for us is to take the money at the beginning of the project. The project should have been run by one of the leading, biggest supermarket chains in Israel. Only afterwards it was passed to the NGO. And what we were trying to do is to bring it also to small businesses. Here you can see the unbelievable number of 205 million shekels out of this program that went to small businesses. Okay, the Israeli market is about 85 to 90% of the big supermarket chains. So this is over 30% that went to small businesses. It also was operated by local authorities. And one of the benefits is now that they have the correct data about the people in need in their city. That's it. Thank you.
And the next speaker is Gilles Darmon from Latet.
Very happy to be with you this morning. My name is Gilles Darmon. I'm the president and founder of Latet, one of the biggest NGOs in Israel. Latet was established in 1996 in order to fight poverty in Israel and to enroll the Israeli civil society to these fights. The main part of our activity is to manage food banks that we create in 1997. So it's meant that we are dealing with the issue of food insecurity for more than 25 years now. Just to be on the same page, I would like to give you a few words about the way a food bank is operating. A food bank concept was actually invented in the States in the 50s of the last centuries. So basically, we are operating a logistic platform that enables us to operate food saving from the food industries, and then to centralize the operation to 3 different warehouses all over the country, and then to send all the food that we either saved, buy, or receive from the Israeli public through 2 different food drives all over the years. So to send this entire amount of food to a network of 210 local NGOs that are in charge of the distribution in front of the needy families. So through this operation, we are able to reach more than 95,000 families all over the country. Of course, we have some arguments regarding the number of families that are living in a situation of food insecurity. But let's say that figure is not so important. The issue is to all agree about the importance of this phenomenon within the Israeli society, and to say that we cannot assume to have a resilient Israeli society without addressing the issue of food insecurity. I'm sorry for the these little issues, but just to give you an idea regarding the importance of collecting data within the work of Latet, it's now more than 20 years that we are publishing what we call the alternative report on poverty. That was actually the first time we decided to invest resource and time in order to generate data. We understand very rapidly that data is power. And one of the most important goals for Latet was to put the issue of food insecurity and poverty within the public agenda. In '97, when we start to deal with food insecurity, it was almost a mystery within the Israeli society. Nobody talked about it. More than that, the government didn't want to hear about it. And then we decided to put all our energy and to build a kind of basis within the Israeli society to raise up these issues. And I think that 20 years later, if the next government will implement their electoral commitments, it seems that finally this issue will be addressed by the public authority. But when we started in '97, it was a triangle of Bermuda of the poverty in Israel. We decided to mainly deal with 3 different tools. So as I said, the alternative poverty reports. Second, in 2013, we create what we call the social labs. Actually, we partner with a significant philanthropist that decide to invest money in Latet in order to produce in-deep data. The goals was to be able to produce data on food insecurity that we will be able to use in a peer-reviewed journals. I hope it will happen sometime, but the idea was to produce a very solid data. And third, depending of the years, we are publishing there and there specific research on specific topics. As an example, what we did with the food insecurity report we produced in last August. So just to give you a few elements regarding how it's built and articulate the alternative poverty report. Actually, the idea is to reach 4 different dimensions of the issue of poverty. First, to get information from the people in need from the fields. And here, I may say that I believe in the information we receive from the field. I think that when you're operating in poverty issue, you cannot start with the assumption that those that share with you data are not exact.
Let's talk to the microphone because it's.
No, I think you do you hear me?
It's broadcasted.
It's broadcasted. Sorry. Okay. Second issue is we understand that we have a permanent dialogue with the head of the NGOs, local NGOs. I talk about this network of 210 local NGOs. And we reached the conclusion that they have a lot of understanding regarding what's happening in the field. So we say, let's use this data and this knowledge. That's why we design a specific questionnaire for these people. And we get a lot of information regarding the ongoing situation in the field. Last, we also find that it will be interesting to ask the audience regarding the situation of food insecurity. Who is in charge? Actually, one of the questions of the questionnaire to the civil society in Israel, who do you think should have to deal with the issue of food insecurity? And if this entity is doing the right job, I have no need to share with you that the government was the first in this lead, but that at those times didn't perform the work. Last, we designed our own multidimensional poverty index in order to get our own measurement regarding the poverty. We start from a very simple statement. We say it's not positive when you have the same entities, I mean the government that is in charge first to deal with poverty, and second, to measure it. We thought, and we still think that there is a conflict of interest in this position, and an independent entity such as Latet has to produce figures in order to feed the public debate, and this is what we did when we design and implement the multidimensional poverty index. So now if I'm jumping to the core issue of our discussion, nutritional insecurity in 2022, we did a poll, a research in August 2022, where we sent a questionnaire to more than 507 people. It was a research that was implemented and articulated by 2 different entities. The first one is ERI, is one of the most professional social research institute in Israel. And the second was Rotem, it's a pool institute. So we all three of us, we design and implement this research in order to get these results. As you see, we reach a bit different conclusion regarding the size of this phenomenon within the Israeli society, reaching the conclusion that there is more than 680,000 families that suffering from nutritional insecurity, where within this group of 680,000 families, you have more than 312,000 families that's suffering from severe food insecurity. And I think this is the most important figures. These families are not so different from what you mentioned, either Eli and Mendi, regarding who is our core target here in Israel. Just to share with you a few elements from the questionnaires we made in front of needed families. We actually questions more than 1,357 different household or head of families in need that receive support from our network of agencies, and you have an idea regarding the impact of the food insecurity within this family, where you have more than 77% of these families that have difficulties to actually access to the food they need on a monthly basis. Same for the percentage of families that need to skip meals or lack money to buy food that they would like to. It's a quite a very strong paradox when you are living in the startup nations, and that we have actually two kind of society. One is living a modern life, and then the other one that is facing survival issues. Same for the situation of the babies and regarding balanced meal. I'm connecting to your speech at the beginning, the difference between food insecurity and nutrition security. We are far from reaching this nutrition security among the population of needy families. So just to share with you one important tools. So we can actually criticize it and say it's relevant, not relevant, but just to give you an idea about what is the gap between living a normal life in terms of food security and being totally outside of the scope. Here we say, okay, what should be, according to nutritionists and health expert, what should be the average expense for a family of 5 with 3 kids? So we reached the conclusion that if you are using the cheapest retail chain, that you need at least for on a monthly base to use at least 3,400 shekel in order to reach an acceptable level of food security. And when we are checking the central business statistic figures and what we get from the, once again, I apologize for this, but when you ask the recipients of the Latet assistance, we get a result of a monthly expense of 2,200 shekel, meaning that actually the monetary gap in food security in Israel is around 1,276 shekel. This is our issue. This is what we have to address. Just to make a simple calculation regarding to the previous number. So this gap, the monthly gaps, multiplied by food severe insecurity, multiplied by 12 months, and then you reach this conclusion that if we want the country, the government, to address significantly the issue of food insecurity, they need to invest at least 4.8 billion shekel in these issues. That's it. Thank you so much.
Thank you, Gilles. And our last but definitely not least speaker is Samah Elkhatib Ayoub from Sikkui.
Good afternoon, everybody. I would thank Professor Aron, Troen, and the organizing committee for giving us the stage to share you all our study that we have published a year ago, Sikkui Opop with Mazon, from various opportunities that deal with food insecurity among Arab society. So my name is Samah Elkhatib Ayoub. I am coordinator planning, advancing planning among Arab. Sikkui is an NGO that advance equality between Arab and Jews in the citizen in this country, and also advance a shared society between Arab Palestinians and Jews in this country. Let's start. In the 10 minutes coming, I will deal with and focus on data from the National Insurance Institute Service. Then I will share you main findings of Sikkui's study, and then under exercising of social rights, the school lunch program, and finally, Sikkui study main recommendation. Surprising findings. Arab children make up approximately 50% of all children suffering from food insecurity in the country. The number of Arab children who suffer from acute food insecurity is 5 times greater than their Jewish counterparts. However, only 1/3 of the Ministry of Education, Schools, Nutrition Programs budget is allocated to Arab schools. Only 1/4 of the eligible Arab families utilize the different allowances provided by the National Insurance Institute. So the gap between the Arab and the Jewish is a survey from the National Insurance Institute conducted 2016 found that about 34% of all Arab families live with food insecurity. Of these, about 26% were in acute food insecurity. On the other hand, about 14% of Jewish families live with food insecurity, and of those, only about 6 were in acute food insecurity. Among children, the situation is even worse. More than 50% of all Arab children live with food insecurity. Of these, about 36% live in acute food insecurity. In Jewish society, there's about 17% of all children live with food insecurity. Of these, about 7% live in acute food security. New data from the National Insurance Institute published in December 2021 after Sikkui's study indicated that the Arab society situation is getting worse, while the situation in other sectors are showing better numbers. So our findings in our study, the state of Israel has no policy at all for food insecurity. The government does not collect data in a structured and systematic way. The only used methods are through periodic surveys. 2 surveys were conducted 2012 and 2016, and new data what we have got in 2021. No long-term planning, no dedicated budget line item, no government body charged with integrating and holistic view of this issue, lack of up-to-date data, lack of clear division of responsibilities between the government bodies, a situation that automatically hurts the disadvantaged minorities, in this case, the Arab minority in the country. So our study also focused on concerning under exercising of social rights that affect this issue. This is a prevalent phenomenon among Arab society due to discriminatory criteria, stereotypes about the service providers, and also a lack of language accessibility. Besides that, the lack of adaptation of services and the criteria of the entitlement to the social and the culture of the characteristic of the Arab population. So the poorer and the more disadvantaged the family, the greater it will suffer from the risk of food insecurity. Also, we focus on our study the school lunch program. Budgetary allocation problems there were. The program is determined based on the size of the existing budget, not based on the needs of the children. And the Arab local authorities needs is at least half of the budget, while they receive only 1/3 of the budget. The more rich local authorities get more government funding to food insecurity, which leads in the end of the day that Arab authorities consequently get a less hot meal for their children. So our main recommendation was to promote the participation of Arab society in the policy planning process and the decision-making centers, such as not only the National Food Security Council, also promote the setting of governmental goals, indicators, and objectives for the Arab society, as well as control mechanisms for their implementation, increasing transparency in all the stages of the related process, increasing accessibility of relevant information to Arab citizens and helping them in exercising their rights. Also establish right extraction centers, one-stop center model in all local authorities in socio-economic cluster between 1 and 4. And finally, planning an egalitarian policy for the budget distribution of the nutrition system that should be based on the Arab children's needs. Thank you for listening.
My apologies. We have another speaker, Gidi Kroch from Leket. My personal mistake. So I owe you one. I'll claim it back. You take it?
No. Shalom to everybody. I'm Gidi, and I'm the CEO of Leket Israel. Unfortunately for all of you, I don't have a presentation. You don't have to focus on what I'm saying and trying to remember it. I think the first thing I'd like to do regarding this discussion is an idea of Leket Israel. We're a food rescue organization, which is a little bit different than the other organization that spoke here. I think the closest to us is probably Latet with its food rescue, but we're doing different type of food rescue. Leket Israel is all about nutrition, it's all about food rescue, it's all about nutrition, and all about impact. And I think one of the things that I'm missing here in the discussion is a discussion on impact. What's the impact? I want to talk. Okay, so I want to talk a little bit about what Leket does, and do that go to the other subjects. The first thing is Leket as a food organization, we rescue only nutritious food. We rescue about, this year we're planning to end it with 30,000 tons of fresh produce picked from the fields and collected from packing houses. And we also have a meal rescue program that we rescue from hotels, the IDF, catering services at workplaces. And that's going to sum up, I think, this year probably close to 1.7 million meals. And a meal is a meal. There's no math here. A meal is a protein and 2 sides. And so that's the essence of the programs itself. And then developing everything is actually the nutrition part of it. And the nutrition is very, very important for us because we believe that as a food organization that comes or that is organized and serves the public, we cannot afford to supply non-nutritious food, which will have an impact on the society or the people that we serve in, let's say, 20, 30 years with all the diseases, cardiovascular and other diseases. So we're 100% nutritious. The organization supplies 100% nutritious food to its constituents, and we've been doing that for years and growing. Just as an example, in 2019, we rescued 15,000 tons, and now we're going to rescue 30,000 tons. And I think that's an amazing growth for an organization with no public support except no government support except fundraising from philanthropy. So that's the idea. We do also a lot of other things, but that's the idea of the organization, and it's important to understand the nutrition part of it. I think the other thing that I'd like to talk about is also the impact. And I think regarding the impact, if we talk about impact, we have to talk about goal. What's the goal that we're setting for ourselves? What's the goal that the government is setting? And unfortunately, there's no answer to that, as far as I see. The government is doing what government is doing. I'm not here to knock the government and say anything bad about it, but when you look at the value of food rescue, where every $1 or shekel creates at least, if you look in the overall organization, $4 or 4 shekels worth of food, that's a ratio of 1 to 4. If you're talking about purchase, then you're talking about a maximum ratio of 1 to 1.5, things like that. So I think there's a big value in food rescue, which unfortunately hasn't been understood yet, I think, to the full extent of it. So I think there's no goal, and that's important to say. And because there's no government goal, I don't see a government goal for food rescue and also for food insecurity. There can't be any metrics provided, because if there's no goal, everybody's doing what they can do the best. And metrics are somewhere between all the organizations that are supplying food. There is measurement, and I think there is measurement that organizations are doing it, but they're doing it like for themselves. We actually, tomorrow is coming out the annual report, the food waste and food rescue report. That's the measurement that we're doing, widely accepted. We've been doing it with the Ministry of Environment for the last 3 years. The data itself is being approved by the Ministry of Agriculture. But still, there's very little impact, or there's very little things that have happened because of this report. But that's our report. It's not a government report, although I think it's embraced by the government and other organizations. But I still think that the data there is partially subjective, because again, we fund this report. I'm not saying that we fudge the numbers or anything, but it's geared towards food rescue. The ideas of what we measure there and the information that we have there is more geared to what Leket is doing at all. And I guess that if a government would do it, it would probably have a very wide aspect, or maybe a wider picture, a wider prism of how to look at things, and not only food waste and food rescue. So I think that goes to say a little bit about the information that's out there, and I think there's a lot of information that is not correct. And when we spoke here about, or the former speakers talked about the numbers here, and there's a difference, I think, a slight difference between what the Latet presents and what the NIS presents. I think maybe the gap is filled that with those that are not registered in the system. I'll tell you a short story that will display it actually. A few days ago, this is a 100% true story. A few days ago, one of my managers came, the volunteer manager came and said, I have a friend. She actually lives very close to where I live, that's been working in a big communication company in Israel. They got divorced. She has the apartment, but nothing else. She got the apartment, the kids, she has 3 kids or 4 kids, and she has nothing else. And she can't support the family anymore. She picked the woman, took a picture of her fridge, almost nothing there, and sent it to friends that can help. Of course, that goes without saying that we supplied as much as we could and what we could. But this woman was not in the system at all, because it's important just to know that the Israeli welfare services does not open welfare cases for food. They open welfare cases for other things, but not for food. Now they will open. Okay, so that's something new. That's something new, probably with Mendi's work in Yerushalaim. But again, this woman would not be registered in the system at all, because I guess her position, I hope the position she's in now is something that she'll grow out of. But for now, she needs food support. She's in food insecurity. The kids are in food insecurity. I don't know if they have school lunches where she lives and where she. So I'm not sure the kids get the nutrition that they're supposed to get, but she doesn't appear in the statistics provided until now. And I'm not sure she'll even open a welfare case, because we hope it's a time issue that she'll go over. That's very important to say. and to know how things are measured also in Israel. Now, when you talk about impact, and I think that's going to be the closing remarks that I have, so my time is coming up, is actually how do we measure impact when we talk about nutrition, we talk about food insecurity. I mean, the government is giving out cards in different ways. There's the Mizam that Mendi spoke about before, and there's other smaller types of programs, but how do we really measure the impact on the population that we serve? And I think that's something that needs to be discussed. But that will require a government to look at all the organizations, combine all the organizations and all the works that are being done in the field, and try to figure out what the real impact is. But again, if there's no goal and there's no one managing this event, then there probably can't be metrics, and measurement will be very, very difficult for the government to do. And that's Roni's position to find out, and I don't envy you in your work here. So I think the first and the most important thing to do is bring the government to the table in all of this and discuss food rescue, food insecurity. It's a big discussion in all the world. We're about 10, 15 years behind the world as always. So when the world wakes up to it, and I think the world is already waking up to it, then we'll still be lagging behind, unfortunately. Thank you very much.
Thank you, Gidi, and I apologize again.
You're only one.
Yeah, just one. So now we have some time for open discussion. You can either raise the question to one of the speakers or make an opinion or whatever, as long as you don't take everybody else's time. So you want to come here? But we need Aron to listen to us.
Sorry. Thanks for all those great presentations. I was wondering with Gidi, have you thought about having external evaluation, because that might lend some more validity, outside validity to the work that you're doing. If you have an outside evaluator, maybe then folks will look at it and say, that's just one thought. The other thing is I understand, I guess it's gleaning. And so you said that it's from farms, but I'm wondering about the meals themselves, and do you have criteria? And I wonder about that for the food banks as well. Is there any criteria for what is healthy? Fruits and vegetables, but I also wonder about, like, in the US, there's been this movement to have less processed food, as less ultra processed food being accepted. And so I'm just wondering about any of that, if any.
Okay, Smada works at Leket. She works with me, and she's our chief nutritionist. And processed food.
Step to the microphone. Smada, you have a step to the microphone.
And I should have said credibility. I guess more credibility for external evaluation.
We're very shy. So in terms of nutrition and regarding the cooked food, we collect the food only from licensed places, caterers, army bases, and thank God we're in an environment that promotes healthy nutrition. So it's became easier to say that we rescue nutritious food in terms of that. Also, because of food safety regulations, so we can't take everything. So we focus on the main dish and the sides, and if they have cooked vegetables. So there's not a lot of places to go wrong in terms of nutrition. It was very interesting for us to know what the percentage of the processed food out of what we rescue, and we examined it a few years ago. It was 5% processed food out of all. So it's not a lot. That's the data that we have, but it's also internal data, so it's not up to that.
Any other question or comment?
Comment on what you said regarding what you asked regarding external evaluation. We worked with Aron on a program on Smadar Lab as well. And that tried to figure out what the impact would be of cards versus, I think, right? Cards versus supplying food or real food, like we do. And that was a study that was done 6 years ago, 5 years ago, 6 years ago. And it was published 8 years ago, and the findings were that this value in delivering food that you see in the eye, as opposed to the cards, this value. But I think eventually there's going to be some kind of a breakdown between cards and, like we're doing now in the Minisymposium, we're supplying vegetables and right.
So I'm Retzef Levi. I'm currently on sabbatical in Israel for the year, but usually I'm a faculty member at MIT. So I've been working on the food space for some time now, but I think that there is a saying, you manage what you measure. And it seems to me that currently, and everybody agreed about that, there is a serious challenge about measurement, both in terms of data collection, but also conceptually, what do you want to measure and what are the goals? So just since I was involved in efforts to integrate data, I just wanted to share a few thoughts about what needs to be put in place if we want to get a chance to start changing the situation. I think that the first order thing is that, government currently seems to fund a lot of these efforts, at least partially, but there is no mandatory expectation for providing data back. And I want maybe to suggest that that should be a consideration of the government. If you want to get funding, part of what you commit to is some standards of reporting, and that's part of what you're expected to do. Because I think that otherwise, there is no progress, and you cannot use these very great work that is being done in the field is not being fed to inform what else the government can and should do. Second, I think that it's very important to create a multidisciplinary team that will create a data scheme of what are the data elements that we would like to collect. And I think that then on top of that, you need to actually build resources to curate the data because, I don't know how many of you have experience with data from the field. It's dirty. Even just, I think one of the things that came about was just identifying who are the people that are in need. It seems that there is on one hand overlap, on the other hand, some people are not there, even though they should be there. So I think you will have to build a team that will support technical aspects of this. And finally, I think that you need to create a community of research around that. And it all goes back, who owns that task? It's a quite ambitious task. And I think that may be something to figure out as quickly as possible. Because I honestly, I think otherwise we're going to be a lot of good intentions and a lot of hard work, but maybe not something that amounts to systematic impact, just to build on the last speakers.
Hi, I'm Eliza Stark. I'm the faculty here at the School of Nutrition. Two things. I do think there is reporting, but if it's not transparent, then people don't know what the results were. So the lack of transparency of the data is unacceptable as a citizen of this country. Everyone has the right to see those data if it's government-funded programs. The other thing is I had a student a few years back that was working in the West Bank for the World Food Program. And she never published her data, but they had this question of food cards or giving out food. But they didn't give fresh fruit. They gave a dry food, rice, oil, these kind of things, versus the card where they could get money. And there was a much greater diversity of foods eaten when they were using the cards. But then again, what was distributed was only dry foods. It wasn't fresh fruits and vegetables. So that's also a big question. And also the big issue of being the food police, what we distribute, how much, and personal choice is a huge issue. And that's something that also is from the nutritional perspective, we're always asking if you're allowing people to buy Coca-Cola, are we doing more harm than good? And that also has to be something that needs to be addressed. You know, and if they're getting Coca-Cola, maybe the taxes should be going to subsidize healthy foods. That keeps coming up. Those are issues that also should be talked about, maybe also in this forum. I think.
By the way, cards, the technology of the cards can be black everything that we want. It's mean we can block Coca-Cola if we want. If the government
right. It's the difference between WIC and food stamps.
The government didn't decide that they want to block it.
Right.
So
in food stamps is
a technical thing. If you ask me, we have.
It's very easy to do.
With cards and with food, but there is. It's also in the States.
Right. Food stamps you can't buy cigarettes and alcohol or whatever.
Cigarettes and alcohol also now in the card. But saying that usually when you're giving food to someone, so we find out that about 15% they're not using because they don't like it. There is another 15% of cost of the delivery. So altogether it's about 25% against the card. So if we get 10% on the card discount from the supermarket, so you're coming more or less to the same point.
Then it might be a very good way of distributing food.
And second, I'm not talking about what the people want. The people, of course, want the card. They don't want nobody. And we made one-time survey and we asked them, either you're going to get the card, one third less, or you're going to get food. About 80% of the people wants card with less money than to give them food.
Okay, because they can pick if their family likes milk products.
It is, but there is also kind of true. There is like the other population, what they like. It's not the same food. I can tell you that when we start with Leket to give food and vegetables, we find out there is a lot of food and vegetables that the Arabs doesn't like, doesn't want. Don't bring it to us.
It's any family. If you give me spring peppers, it might.
Like a society. We have the biggest organization to the Arabs in Israel. But I'm saying, so in the end of the day, Carl have a lot of. What we did in our program, in government program, it's like the people receiving about 50 pounds of fruits and vegetables, but this is very expensive in Israel. Usually the people under the poverty line or poor people doesn't have any foods and vegetables, only potatoes and the carrots and onion and not other things. So we're giving the card, and beside the card, we're giving them also 50 pounds of fruits and vegetables that they're receiving to them. So I think this is what's bringing to some kind of level. But again, this is philosophical questions. Like,
of course.
How, what, and it's like.
Yeah, definitely an issue, but I think that the issue of free choice per family, the flexibility of the cards. You have young children, you want this, you have older children, you want Y. But I do think maybe we should have a little bit more say what is chosen, because you can certainly buy.
We can block the card. If the government decides to block the card, let's say something, so we can block the card and the card not going to be able to buy it.
So it's very easy to do.
No, not in food stamps.
But in WIC. WIC does for mother and children, yeah. So again, these are issues that also need to be addressed, and I think it's wonderful that there's so many different organizations that everyone comes together to talk and try and make a better policy. And it's a shame Aron's not here, because this is definitely one of his passions, and we miss him very much, but we understand that he's not here. And I think there is a role for academia. There are 5 schools of nutritional sciences in Israel. There are lots of nutritionists. Smadar is here, a few from the Ministry of Health, but there's a lot of manpower that has nutrition on the top of their agenda. And I think you should reach out to us. We don't have a lot of money because nutritionists don't make a lot of money, but we have a lot of passion and an ideological basis to try and improve the quality of what is eaten in Israel.
Thank you. Yes.
there is a missing elephant here is that there is no political will. This year, it's the first time that 46 million in the base of the budget and another 100 million were put in the budget for food security. But we are talking a lot, but there is no government policy or aim to reduce poverty or to improve food security. So if there is no this government decision how to reduce poverty or to reduce poverty to 20% or to 18% or even to 2%, and there is no government goal to reduce food insecurity among the Arab population from 43.2 to 20%, for example, there can be a lot of data and we can have a lot of plans, but actually there is no political will to end poverty or to end food insecurity. And this is the missing elephant here in the room. It's here, there is no political will. The only 1 billion shekel that we will receive now, it's for political reason, for political public. There is no political will to deal with this issue. And with all the good people and the good organizations and the good academics that want to improve the situation, there will be no improvement until the Israeli government will make a decision that fighting food insecurity or fighting poverty, its main issue for it.
Awareness in the public itself is the public aware so that they could groundswell.
The public is more aware, but still not the majority of the public.
Let's just not let these words discourage us from continuing what we're doing right now.
Yeah, yeah, sure. So I'm Levin. I'm a professor of epidemiology at the School of Public Health at the University of Hadassah, the chairman of the Israeli Association of Public Health Physicians. So I want to address what Shai said. I mean, the issue of political will is clearly a major problem. And, we can talk, but if there is no political will, we are not going to see a real change. But I would continue and say, okay, so it's our obligation, and Aron and many of the people around here are trying to do that, is also our obligation to change the situation. And I must say that we also have a window of opportunity. You may call me, a relentless optimist, but the government, both the government that is now finishing its duty, which reestablished the Moatza, etc., and also probably to be formed soon, the new government. Actually, some of the parties said in their elections campaign that they are, like Shas said, Re'evim L'Shinui, they are concerned from hunger in Israel. Of course, we know the problems, we know that it's taken the wrong direction, in my opinion, but that's an opportunity for us to redirect to the right places. Here, as we learned today from the US experience, it's our role, and I'm part of the scientific committee of the Moatza L'Bitachon Tzunati, it's our role to make those that are now hidden, to show them, show the hunger in Israel, show the food and nutritional insecurity in Israel, put it on the table for the decision makers, and also to gain the political will. We cannot leave the floor and say we are professionals, we are not there. We have to get out of our campuses and get the politicians to do what they have to do, which is to take care of public health. So I just want to say that we need to be more positive in the sense that we should still aspire for change. Although I agree that the political will is more political than actually a will to promote public health. Thank you.
Okay, so first of all, I want to thank all the speakers and presenters, and I want to thank everybody who came here to either participate actively or passively. I think it's every voice counts in this arena. So there's a continued close discussion of the members of the National Security Council, Food Security Council, and the Scientific Advisory Committee. It is going to be in Tzrif 8, which is class number 8. Of course, those of you who are not from here will not know that, but maybe Moran, you can lead the people over there now. So Moran will be waiting here by the door to those that are going to Tzrif 8. And thanks again for taking part.